be the doctor, right?
Yeah.
Okay, all right. So the case is that you are dealing with a 27-year-old in accident and emergency department. They've got
Okay.
chest pain. You have to take their history and you have to do their management. That is it. You are in
Okay,
FY2, you know that, and this is a scenario. Whenever you're ready, we can start.
I'm ready. Well, you can start right now.
All right, let me just get the timer and then we begin. But like, can you give me just a minute? Just a minute. Just a minute.
Take your time. Just let me know when you're ready.
All right, Dr. Shetty, should we start?
Yeah, sure.
Okay, let us begin. Let us begin. I'm just going to start the GMC bell. And
Yeah. Okay. Can we start?
Yeah. Let me just do it again. I hope you could hear it.
Yeah. Dr. Anusha, GMC number 77, whatever. Hi, I'm Dr. Anusha, one of the junior doctors in accident and emergency. May I please confirm your name and your date of birth, please?
Yes, doctor. My name is Sean, and I'm 27 years old.
Hello, Sean. Nice to meet you. How are you doing today?
Well, doctor, I'm in pain, and I don't, I've got this pain in my chest, and this is why I got in the hospital here today.
Oh dear. Since for how long have you been having this pain?
Well, doctor, it's been there for like a few days now.
Okay. Can you tell me more about it?
Yes, doctor. The thing is that, it's been there since few days, and it just started all of a sudden, and it's like a dull pain, but I just don't know why this happened. It kind of became very bothersome today, so I thought that I should come and see.
Okay, so you haven't consulted it prior, right? So today is the first time you're consulting.
Yeah.
Okay, so does your dull pain go anywhere? Does it travel to your hand or to your neck?
No, doctor.
Okay, it's just, where is it exactly in the chest?
Well, just here, just next to my rib.
Okay, so also asking, did you have any fever in the recent past, just before it started?
No, doctor.
Okay, so what do you work as?
Well, I work as a carpenter.
Okay, so how's everything with work?
It's all good.
Okay, did you lift anything heavier, or do you remember, hurting your chest?
Yeah, now that I think of it, just 3 days ago, I was just lifting a screwdriver, and it just fell on my chest.
Oh dear, that's an awful thing to happen. So you didn't take a notice of it, is it?
No, I did not.
I
But
get
could
it.
that be it? But could that be it? I mean, it's a very bad pain. I've never had this pain before in my life.
Well, what do you think is going on?
I don't
You
know,
think
like my father, he had an accident, and then like after a day he passed away, and they said that it was a heart attack, and I was thinking, and he was young, he was 35 and I'm 27, so I'm thinking this could be that. I mean, I couldn't relate it to as you made me think of it, but I feel like it might be that.
Oh dear, that's like a very sad thing to happen, accept my condolences, but then, that's really bad. I'm really sorry for what happened to him. But then, I'll just ask you a few questions just to rule out a few things. Is that okay?
Yeah, please go ahead.
Okay. You said you had no fever, right?
No, doctor.
Okay. Any burning burning while peeing?
No, doctor.
Okay. Any joint pain?
No, doctor.
Any rashes?
No, doctor.
Okay. You didn't have a very bad pain in the chest. That is what you said, right? It was very
Yeah,
dull.
yeah, it's a dull sort of pain, and I'd call it a bad pain.
Okay. And there was no respiratory infection. Was there any?
What do you mean by that, doctor?
Did you have any breathlessness or cough?
No, doctor.
Okay, fine. Okay, coming from that, I'll ask you a few things about your personal life. How is your diet?
Well, doctor, my diet, I guess, is good.
Okay.
I eat healthy.
Do you smoke?
No, doctor, I do not smoke.
Do you drink alcohol?
No, doctor, I don't drink alcohol.
Okay, sometimes just to rule out a few things, I just have to ask you, do you take any drugs, like, illegal drugs?
No, doctor, I tried heroin like 3 years ago, but that was just once. I was in Goa and, I was just having fun with my friends, and I didn't like it. I did take it once. I did try it once.
Okay, that's great then. Do you take any medicines?
Like what?
Have you taken any for the chest pain?
Yeah, I did try taking Panadol, and it did reduce my pain, but the moment the effect was gone, it was over.
Okay, okay. Okay. Also, have you taken any other drugs over the counter, herbals?
No, no, doctor, no.
Are you allergic to anything?
No, I'm not. Not really.
Okay. Apart from this, do you want to tell me anything that you think is significant?
No.
Okay. What worries you a lot today? Apart from that, you told me that your dad, died out of heart attack. Is there anything else that concerns you?
No, I just want to know whether I'm gonna die of this pain.
Okay. I would like to, I'm done with the questions. Thank you so much. I would like to examine you. I would like to examine your chest. I would like you to be exposed sufficiently. I'll provide you with a chaperone. Is that okay?
All right. Okay.
Okay. So I would also like to do a chest X-ray and the initial ECG.
Yeah. All right, doctor.
Okay. From what I see and what history you've given, I don't think there's much for you to be scared of. I just think it's a mechanical pain that happened because, of the screwdriver.
Mechanical pain, doctor. What does that mean?
That just mean to say that, just overuse or just because the muscles were strained and you had pain in the chest, and it can go by itself, or we can give some medicines to treat it. What do you prefer?
Well, doctor, how do you know it's gonna go by myself? I mean, itself. I mean, I don't know. Like I told you, I'm very worried about it being a heart attack, like my father had. So
Sorry,
I mean,
is there any investigation, is there any finding?
no,
Sorry, I forgot.
everything is normal. Everything is normal.
Okay, from what investigations we've done, we've not got anything, so I suppose that it's just the chest pain. Okay, because of the mechanical chest pain, because of the screwdriver.
All right, doctor. Okay, if you say so.
Okay, so I don't think you should be scared. I understand that 35 years with your dad is a pretty young age to deal with heart attack. We can do one more appointment, screen you for several things which are related to, like, cardiac disease in young people. How does it
Okay.
sound to you?
All right. Okay.
Okay, so after that I'll refer to a specialist so that they can see a few things which might screen you for possibility of cardiac arrest in young.
All right.
Okay.
Okay.
For now, I understand that you have a lot of pain and you took Panadol. It didn't work, so I'll give you a little stronger painkiller, but then that might cost you a little.
All right. Dr. Shetty, the time's up. The time's up.
Yeah. Sorry,
Okay.
I'm a child. Sorry.
Why? Why are you sorry?
I couldn't finish. Oh God.
No, you did good. You did good. See,
Thank you.
I don't know if you've done this before or not, but you know, you
No.
did good. The only thing was that you were nervous. Why?
Yeah, because sorry, I have a kid, so like
Okay,
management.
that's okay. That's all right. That's all right. You're confident enough to do it, but don't be nervous because that's what shows, right? That's what shows. So don't
It
be
shows.
nervous. Yeah, it
Yeah,
definitely shows.
yeah,
So, you know, when you started your station, first of all, you know, the diagnosis here is quite straightforward. It's
yeah,
musculocutaneous, you know, pain, right?
yeah,
Musculoskeletal pain. So you know that, right? Like when you
yeah,
know that, it's good to, you know, like exclude the things, right? Like for example, flu, fever, trauma, etc. Good. But once you have the diagnosis, don't ask more questions, right? Unless you feel like you're trying to exclude the sinister things, right? Like you could have asked things regarding the shortness of breath, any burning in the chest, right? Like if we're trying to exclude what is it called? The God, or if we're trying to exclude, you know, the any pulmonary
No, no, I was
embolisms,
coming to.
etc.
I was thinking of pericarditis, so I was
Mhm.
excluding all the viral
Yes, you would,
infections and
you would. You would,
SLE.
you
Like,
would. I know what I'm trying to say here is that not all of it, because you know you took around 6 minutes
yeah,
to
yeah,
get the history, and that's what we're doing. I'm just trying to tell you that you know we all are doing the same. So how do we
yeah,
reduce it? We have to take a relevant history, right? The relevant history here would be that if you think like it's musculoskeletal, maybe you could ask of trauma, which you did, and then you could have asked for you know any fall or what he does. That was good that you caught on to him earlier. That you know what do you do? Then
yeah.
you asked him that you know something. Now, your question that you asked was, is everything okay at work, right? What does that
Okay,
mean,
yeah.
right? So like the verbalization that you had, that was a little, you know, a little off the line.
Oh,
And when
okay,
you
okay, yeah, good.
started,
Yeah,
right? When you
yeah,
started, when the person said they had chest pain, so you said like, how long has it been, right? But it's good. Like you could start with, you know, the onset, which is the Socrates O. But how about you
yeah,
say, can you tell me about it? Then you came back and you started on, if you could tell me more about it. But like at the beginning, if you could start off from like, you know, like an
yeah. I
open ended
forgot that. Yeah, 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 yeah,
and then when the patient told you that you know his father died, you did show empathy, right? You definitely showed it, but they tell you that you know it's a real life situation. You have to be like that. So in a real life
yeah,
situation, if somebody had told you that their father died or so, you show empathy, then you give it a pause, just a second, tiny minutes pause, and then you can say, are you comfortable enough to proceed further, right? That'll show that even
yeah,
though it's a make believe scenario, we're still trying to make sure that you know we're being empathetic enough so that you know it kind of looks real, right?
yeah, yeah. Get it.
Right.
Yeah,
Okay.
totally
And
correct.
then
Yeah.
yeah, that's what I think. I'm sure there are other people too who would be giving you feedbacks. Then the
Yes.
question, then you said that, you know, may I ask you some personal questions, right? So we did the day before, I guess, we did the
Okay.
errors that one sees in the plab2 exam that was by GMC,
Okay.
asking about alcohol and diet is not personal, right?
Okay.
Alcohol,
Okay.
smoking, that is not personal. In the UK, that's normal, right? Being lesbian, being gay, being bi, drinking, smoking, that's normal. You can ask these questions. That is normal, right? That is
Okay.
something that they do, and they're even allowed to, you know, like drink 14 units of alcohol in a week, right? The thing
Yeah.
which you should be signposting for are the things that you think are intimate, right? Intimate meaning
Okay.
if you're going to ask them about how's your sex life, right? Or when you know you were asking them that you know about the drugs, you were trying to signpost, but you did good that you know sometimes we have to ask questions, but then you stopped there, right? Because you were trying to recall what phrase it is. This is why it's
Yeah.
better to you know, use phrases that you are familiar with, or just you can create on yourself, because you know I'm sure you've been speaking English all the time, right? I don't know where you're from, but we know better English than the native speakers there. So I know you know the sentences. You just need to be confident, right, Dr. Shetty? Right?
Yeah. 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 Correct. 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 Yeah.
Right?
I know.
And
Yeah.
yeah, and then again, you know, like when I told you that you know, like you said that it's not something great, etc. Then I said that you know my father died of pain because you were, I think you were trying to get the eyes part out, right? Like you started with
Yeah.
the
Yeah.
concern,
Yeah.
but when he showed you the concern, you moved forward to the examination. No, you have to, you know, like I know we want to get there, we want to get done with the history, etc. But if you see, our marks depend on how we respond to the patient, right? What the patient says. This is what our marks are dependent on. Yes, it is on what the examiner is listening to and what the station's about. But if the patient takes a scenario anywhere, we're not supposed, we don't know when they say chest pain, it's like an open-ended thing. There are so many things that could happen in a 27-year-old, but we have to listen to the patient. So active listening is when you're definitely listening to him, you respond to him, you acknowledge it, you reflect on it. You did acknowledge that at that point. I know you did it earlier too, but then I guess you got bored, or you wanted to move along, so you went
Yeah,
on
I
with
just
the
wanted to. I thought it was like killing time, so I was just thinking too much. I was just
yeah,
thinking,
that
okay, I've done this.
no, you asked almost everything except the psychosocial thing. You asked almost everything. You asked about fever, you asked about swelling, the flu, right? Like the big things, right? And you did ask about the travel history, I guess. You did ask that, no?
Yeah. No,
Okay, you
travel I
asked about
didn't ask.
the travel history is kind of important if you
Important,
think like
yeah.
something that happened, because
Yeah.
he's having chest pain that is just localized, right? So it could be associated with traveling. And then family history you did ask, right? Just in this one, you instead of just saying the examination like you ratified it, how about you explain it to the patient, right? How about you explain to the
Yeah.
patient that if it's all right with you, I'd like to examine you, like like a proper kind of introduction. That is it okay with you if I examine you? Whatever words you want to use, right? Then you could have said that, I'm going to check your chest. First, I'm going to do your general physical if you want to, depending on what you want to do. Then you could say, I'm going to expect, or I'm going to examine your chest. I'll be, looking for this and this, like I'm going to do this, I'm going to check that. And then you can just tell them what are your findings, right?
Okay.
You can even say it out to the
Okay.
patient, right? Because
I mean, we don't
this part,
examine, right? How to tell the patient,
like for example, you could tell to the patient that, all right, I'm going to check your vitals, and I've checked your pulse, that seems normal. I've checked your
no,
now
but
I'm
then
going to check your
the examiner tells, right? You tell the examiner, and the examiner tells you everything is normal or not.
at the end, right? So all right, you're very right, because I'm learning too. So all, or maybe we could just say like this, that so I'm going to examine your pulse, right?
Yeah.
I'm checking your BP, and I'm going to inspect your chest. I'm going to do
Yeah.
palpation, percussion, auscultation, and at the end
Yeah.
I'd also be going for some lab tests, right? Then is when you can just ask them that, is there anything that they expect? Because before giving you provisional diagnosis, I guess we need to do the eyes thing, and you just could say that, is there anything that you expect from this, isn't it?
Yeah.
I guess
Yeah.
so, right?
Okay.
So
Okay.
everything was, yeah, right, and everything was almost good. Just the part when you were explaining them the provisional diagnosis, that's where you got, like more confused, right?
Yeah, I was running
So
out of time. Yeah, I was trying
yeah,
to make it
don't think
quick.
like that. See, you're gonna run out of time anyway. I think that the thing is that when we practice, we'll definitely be doing better. However, instead of being afraid of time, how about we learn and like stay calm, because they clearly say in the errors to avoid that you have to stay calm, right? Even though we're running out of time, we still have to stay calm, like nothing wrong is going to happen, right? That's what they're trying to
Yeah.
say, if we stay calm or not. If we do all the examination within time, we'll only do it when we're actually uh have practice enough. That's when we do it in time, because it's the initial part and we're still learning. But like remaining calm is the all part of it, I guess so, right?
Yeah.
So
Yeah. Yeah.
right, so that's the only thing that I noticed. And then I guess the management part, you could have said that I'm going to involve the senior. And when I said that, I'm worried it could be a heart attack, and how could you just say that? That's when you said that, what are the results? That's all right. It's okay. I'll forget too. When I'm talking a lot right now, but when I'm going to practice, you see, I forget things, right? So, so
Yeah.
yeah.
No
So the
problem.
thing is, right? So just don't force them. If
Yeah.
they
Okay.
feel like
Yeah.
it's non-musculoskeletal pain, right? I was being a kind of bad patient. If they feel like it's non-musculoskeletal pain, don't force them to believe it. You'll just say, all right, we can
Okay.
run some more tests. I'll involve the senior. And because I've been seeing this, it seems like it's not the problem, but because you're concerned, we try and involve the senior, and
Oh.
we'd be
Okay.
running
Okay.
some more tests, right? So
Right.
that we
Right.
don't
Yeah.
force the patient. Yeah, we
Right.
don't want to
Right.
force
Right.
the patient ever, right, Dr. Shetty?
Yeah.
Yeah.
Right. 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 Yeah. Yeah.
Anybody
Right.
else has any other feedbacks to give to Dr. Shetty? Okay.
Dr. Hafsa, Nichols here.
Hi, Dr. Nichols.
Hi. What's in this case? What is the advice like in terms of safety netting? How will you go about safety netting for this case?
Because if the patient is worried about having a heart attack, right? If the person is worried about having a heart attack, right? How about we tell them that since you're worried about it, because this is a case of musculoskeletal pain, there is no safety net in here because it cannot get worse. But if the patient is worried about myocardial infarction, how about we explain things to him regarding MI? And tell them that if you have any overbearing pain that radiates to your arm, your neck, your jaw, please do not hesitate to contact us and dial 999, right? And if it gets worse, seek help, right? This is like, as if we think as a doctor, that's how it would be safety net in it, no? Because if he's
Okay.
worried about it, let's educate him, no? That's what I think. I
Okay.
might be right. Like if he has a severe chest pain, if he develops breathlessness, he should come and seek help, right? Because that'll be the sign of either a pulmonary embolism, right, or a severe MI. No,
Okay. All right. Thank you.
makes sense or not? That's what
Yeah, it
I'm
makes.
thinking, right?
Yeah, I was
Okay.
just trying to tie it in with the case, like how we go about. Okay, so it makes sense. Thanks.
No worries. Okay, so anybody else who wants to practice and would be doing more cases?
Okay, I'm ready.
Okay, who is this? May I know your name?
May.
May. Am I saying it right? Okay.
Yeah.
Okay, May. All right. All right, May. So whenever you're ready, we can start. Dr. Muiz, are you there? Dr. Nazik, Dr. Muiz, are you guys here? You're my +1.
Yes,
Are you guys
doctor, we are
here?
here.
Okay,
Yes,
that
we are
is
here.
awesome.
Whenever nobody else is willing, I'm here.
Okay, how about you be the patient now? And then you can be the doctor as well.
Perfect, perfect. I can be the patient.
All right. Dr. Muiz is a patient and Dr. May is the doctor. Then Dr. Ushna would be the patient, Dr. Muiz would be the doctor, and then Dr. Ushna would be the doctor. All right? Yeah. So Dr. Aisha Abdulaziz, I think, is saying that how do we tackle if the patient says, am I going to die? Right. So what I think, first of all, you need to acknowledge, you'd be saying that I can understand. Instead of saying I can understand, you could say, I see that this is what worries you, but let me reassure you, I'm here to help you out. And I'd make sure that we discuss this. However, at the moment, according to the labs and the investigations that I've carried out, it doesn't seem so. But don't worry, I'm going to involve my senior and we'll run some more tests to make sure that everything goes fine. Do not worry, we're here to help you, right? Like giving them support, empathy, because that will maybe decrease their fear of dying, right? Like we want to calm them down. We want to give them the reasons that, this is a reason that we don't think that you're going to die. And like tackling it up and involving the senior and telling them that we're here if anything goes wrong. I think that's the way to go about it. And that's what Dr. Mo has also said in his lectures. All right, Dr. Aisha, do you agree or do you understand? Or am I going on the right track? I hope that's a yes. So Dr. Moyes, you're going to be the patient and Dr. May is going to be the doctor. Dr. May, are you ready?
Where's the stem, doctor?
You're going to be the doctor, right? Okay.
Okay, okay.
All right, all right. Okay, so I'm going to start the timer whenever you guys are ready. Dr. Moyes, should we begin? You can pick any
I'm
case.
ready.
What we have for today is, herpes zoster, shortness of breath, peripheral artery disease. You could also do pulmonary embolism, heart failure, anything you want to simulate. Arrhythmias, it's all on you. It's an open house. Yeah. Okay.
I'm ready.
All right. So I'm just going to start the timer now. All right, Dr. May, is that okay?
Okay, doctor, I'm with you. Hello?
Hello, doctor.
My name is Dr. May, one of the doctors here in the GP. Could you confirm your name and age, please?
Doctor, my name is Max. I'm 27 years old.
Well, Max, could you tell me what brought you to to the clinic today?
Well, doctor, I'm having this chest pain, like just in middle of my uh, here, just middle of my chest, and I feel really
Um,
breathless. That's why I feel as though I cannot breathe.
oh, I'm so sorry for that. But could you tell me more about that pain?
Well, doctor, it's just here in middle of my chest, and it's
Uh-huh.
radiating to my neck, my arm, and it's pretty
Mm.
much, yeah, very difficult to breathe with it.
Oh, so are you comfortable now to talk?
Well, I can manage, doctor. Yeah.
Uh-huh. Okay, so since when did this pain start?
Um. Well, doctor, it's been almost, I would say,
It's been
2
almost
days. I think 2 days,
uh-huh,
doctor.
2
2 days.
days.
Before,
2 days. Okay.
suddenly I was sitting and yeah,
Uh-huh.
I started having this pain. But before, it was only there when I was walking. I was doing some exertion like that. But now it's all the time, more or less. Yeah.
So the pain starts 2 days while you were sitting, and now it starts getting worse, right?
Yes, doctor, it's getting worse.
Uh-huh. Anything specifically makes it worse?
Well, exercising, walking up the stairs, mm,
Mm-hmm.
breathing
So
too,
any
like
position?
basically breathing
Mm-hmm.
too hard, putting pressure on my chest, and lifting some heavy weight. This kind of stuff make it bad.
Okay, okay. I'm so sorry for what you've been through. Okay. And any specific posture increasing that pain?
Well, doctor, if I try to bend, it does make it little bad. Yeah, bending makes it bad. Like yeah, moving and
Okay.
bending, yeah, makes it bad. Yeah.
Okay. So anything makes it better?
Well, if I just stay still, I take medication, some painkiller, they help. Yeah.
Uh-huh. Okay, okay. And could you score your pain from 1 is the least and 10 is the most?
I would say four, doctor, 4, 5.
Mm. Okay, okay. And anything else along with that pain?
Well, no, doctor, nothing else beside that I noticed.
I think you mentioned that you have shortness of breath. Am I right?
Yes, doctor, that is there.
Uh-huh.
But beside that, nothing else
Okay.
I noticed.
And
But
this
probably
shortness
that's because of my pain.
because of?
I was saying this shortness of breath mostly because of my pain, doctor. When I breathe, so there's more
Yeah, yeah,
pain. So that's why I
yeah,
try
yeah.
to avoid this breathing. Yeah. So it
Uh,
could be
I
because of that,
understand your
doctor, I think.
concern. Yeah, I understand your
Yes,
concern. So
doctor.
since when did this shortness of breath start?
Well, doctor,
Mm-hmm.
mm, same time, doctor. Same time the pain started.
Same time. Okay. So do you have any fever or flu-like symptoms recently?
No, doctor. Not that I noticed.
Okay. And do you have any heart racing?
Uh, Not that I noticed, doctor.
Sorry?
And not that I noticed.
No. Okay. And any trauma to your chest recently?
No, doctor. Not that I noticed.
Uh, okay. Any cough?
Mm, no, no, doctor. Actually,
Any swelling in your body?
no, no, doctor. But I
Mhm.
did. I used to go to
Uh-huh.
gym and I did lift very
Uh-huh.
heavy weight. So maybe that could be
Uh,
the reason. Is it possible?
uh-huh. Uh-huh. Oh,
Could I have
okay,
ruptured my
okay.
muscle? Something like that?
Well, until that point, we will go through some questions. I will go to this point later. Okay.
Okay, doctor.
Did you have any? Did you have this condition before?
No, doctor, it's my first time.
Do you have any general medical condition?
No, doctor.
Are you on any medication?
No, not at all, doctor.
Any allergy?
No, not to my knowledge, doctor.
Okay. Any family history of a similar condition or any chest condition in the family?
No, not to my knowledge, doctor.
Okay. So, what did you do for living?
Well, doctor. Well,
Hmm?
actually, I'm just a college student, and my parents are supporting me.
Okay. Do you smoke?
I used to smoke. Actually, I do smoke. Yeah, but not that often, doctor.
How many cigarettes per day for how long?
I've been smoking almost since 7 years, and I would say 2 to 3 smoke a day. Yeah, sometimes I do, sometimes I don't. Not like every day.
Okay. Okay. Now I will examine you, check your general observations, vital like blood pressure, temperature, and pulse. I will examine your chest. I will do a chest X-ray for you too. Okay, and heart racing. Okay.
Okay, doctor.
Any finding?
Nothing. Just pulse a little bit high due to pain.
Okay. So according to the result of the examination, and thank you for giving me this information and letting me examining you. But before we go through the diagnosis, do you have any idea what might goes on with you?
I'm worried I might have some muscle rupture.
Muscle rupture.
Is
Okay.
it-
Okay, it's a valid concern. But with examining you with muscle rupture, it could be a pain with touching or touching your chest, but I didn't find any pain. Okay, and we did X-ray, and fortunately, it goes free with no abnormalities. Okay, so I think it's
Okay, doctor.
I think your chest pain is a result of uh, uh, a musculoskeletal problem. I mean, not a tear, but just maybe
Yeah.
when you hold these heavy things in the gym, so the muscles is
All right,
stretched
all right.
more than
Okay,
usual. I
okay.
mean,
Dr. May, the time's up. Can you guys hear me? The time's up.
yeah, okay.
Right. Okay. So, Dr. May, you did good. You did ask the whole history, but unfortunately, even at 8 minutes, we couldn't come to the management time. Right. So, could you tell me what was the reason? I mean, what was the diagnosis, and why do you think you couldn't come to the end of the diagnosis? First of all, your explanation of the diagnosis was very good. Your carrying out of the conversation was good. The consultation was good. Your empathy was good. The only thing was timing that I noticed. I mean, you were asking the right questions, but what do you think is the reason that you couldn't complete it within 8 minutes?
Well, I don't want to be so hard, but I think the patient was answering so slowly.
Yeah.
It may be the normal thing in the exam. I don't know, but I
No,
think the
that is
patient
true.
is talking slowly, so I give him the time. I was running
Okay.
after him in
All
the
right.
questions.
All right. Okay, let's just attribute a minute to it. So what else? What else do you think would be the reasons? Did you ask him about the travel history and the trauma,
I asked
psychosocial?
about the trauma. I asked about the trauma, but no travel. I asked about the occupation. He told me he's a student, and he left a heavy object in the jam, and after that he got that pain. So and
Did you
I did
ask about the
X-ray.
psychosocial impact of the pain?
Yeah, I understand it's important question, but just 2 days. I think it's when it be a long time. maybe we will ask about that question. It's my
Yeah, that's
opinion.
true.
It could be
That's
wrong.
true. That's true. That if it's a chronic pain, that's when you should be asking about it. So he just did say 3. Dr. Mice, what was the diagnosis? Was it musculoskeletal?
It was just a strain, simple strain, musculoskeletal. Yeah, just a
Yes,
simple
I think
strain. Yeah.
nothing in the X-ray. At the first, I was suspected pneumothorax, but for that I did X-ray and nothing revealed in X-ray. So it just a strain or a stretching, overstretching of the muscles that
You
they
did
cause
good.
that pain.
You did good. Just the timing is the issue here. That's it. The rest of it, the explanation was good. You were kind of stuttering at the end, but the rest of it was all good, right? Your IPS was good. Your history taken was good. We didn't get to the management part. And if you were to manage, you would be doing the chest X-ray further on, and you'd be involved in the senior. Then you tell them that we're going to give you some painkillers. It's self-limiting, and you could just get a sick note, some rest, and like safety net for Emma.
Yeah.
That is it. Apart from that, I guess you did awesome
Mhm.
to me.
But
In
doctor,
my
in real
opinion.
exam, how?
Hmm.
Yeah, in real exam, what will be my result in this station? May I fail or what?
See, if you are just going to take history in 7 minutes, right? In 7 to 6 minutes, if you take history, because we have 4 parts in our plab 2, right? We have sorry, not 4, 3 parts in plab 2. Number 1 is our data gathering. Number 2 is our management skills, clinical management skills. Number 3 is IPS. Even if your IPS is, let's say, 2 marks, right? Like if you do reflect and you are acknowledging, you're actively listening, you're creating a good repo, you're going to get 2 marks there. And if your history is to the point, like everything you've asked, you've now it's not just history. Data gathering is not just history. Data gathering includes your history, your examination, your lab investigations, and your format of the diagnosis, right? Meaning that you're going to come and get to the diagnosis through that point. That is your data gathering. So in that, like you did the history, it was good. You did the examination almost up to the mark, right? All of it. Labs, you did good. Examination, you did good. You're going to get 4 in that. And 2, in IPS. If then definitely we need 6 marks to pass. Definitely you'd get there. But the management definitely, because we're just guessing here. The management bit we're supposed to get there, right? At least this means that at 4 minutes we're supposed to end the history, right? At 4 to 5 minutes, let's end the history. And that can only happen if we practice a lot, because then we can feel the time. But now it's been 8 minutes, right? So that's what they say, that if you keep on practicing, like reduce the questions, and as you move along, you'd feel like that. And if it's a musculoskeletal case, like you asked in the beginning, what is your concern? And if you like get to diagnose that it's a musculoskeletal case, you removed out everything, right? The lab investigations are to confirm the things that we already know. If you feel like that was for musculoskeletal, then you could have not asked about travel history if you don't want to, right? However, it's important because it could be sinister. You can skip diet, you can skip alcohol, but do not skip smoking, right? In chest pain, do not skip smoking. Then you can skip the allergy history, right? You can skip the family history, because in families, the chest pain due to falling of an object or carrying of an object does not happen, so you could skip that. And then occupational history is fine, but if it's a new thing, right? Like if it's a 3 days old pain, if you want to miss on the occupational history, fine. But your medication, any of the medication, the allergy history, and the family history are important in many of the cases. So in, I guess, history taken, the flaws, meaning the fever, you should ask about the fever, the lethargy, the appetite, the weight loss and swelling, just to take the sinister things out. Then you should definitely be always asking psychosocial, right? Like how are things working? Where do you live? What do you do? Things like that. And the third thing, that is ice, right? These are very, very important to be asked if we want to do good. So I guess that it's going to be a 6 or 7, as far as I know. I've just got into this, so that's what I think. Anybody else with other opinions could give you that along with the review. That's it from my side. Can you guys hear me?
Thank you, doctor. Thank you, doctor.
All right, Dr. May, where is your, okay, no, let's not ask that. Let's not ask that. Dr. Ushna, are you there? I think she left. Okay. Red flags, psychosocial and ICE is really, really important. Dr. Moyes, do you want to do this
Which one, doctor? The patient, maybe I'm allowed to be the patient? Okay, no
Yeah,
problem.
you can be the patient. You can definitely be the patient. You can
Hey,
definitely
I'm
be the
sorry,
patient.
I was here. I just something went wrong with my phone. I couldn't
Okay, all right, no
unmute
worries, no
it.
worries, no worries. So I don't know if Dr. Moise is here or not. So Dr. Ushna, you want to be the patient or the doctor?
I can be either one, whatever you want.
Have you practiced before?
Yes, I have been practicing. I just got my I'm sorry for my parents. I got my exam cancelled today, so
Congratulations. You got
okay,
more
thank
time.
you.
You got more time. You got more time, right? I think it's good. Yeah, like you're gonna be
Yeah,
close to your parents
yeah,
for time. I
yeah.
don't know. Just trying to, like
I just want to
make
say
it better
one
for
thing in
you.
Urdu. वो
Yeah,
कहते
yeah.
हैं कि बाकी जो हम लोगों के लिए सब कुछ अच्छा होता है हमारे लिए जो होता है अच्छे के लिए होता है. So
No,
let's
I
hope it
think
happens for
you're
the
right.
best.
Yeah, yeah. We believe in that, right? Like I'm sure that you were there during the time when we had our OET cancelled. So, you
Yeah.
understand we've been dealing through a lot. So toughest soldiers deal with the toughest kind of battles, right? So don't worry, you're gonna get there. Inshallah, we're gonna get there together. Okay, hopefully. Yes, Dr. Hamida, are you there? Do you want to practice? I think you were
Yes.
raising your hand. Yeah. All right. So you should be the doctor. Dr. Ushna is going to be the patient. Then Dr. Moise, I don't know if he's still there or not. Then he can join in. Right?
Okay.
Okay.
All right. So you're going to be the doctor. Dr. Ushna is going to be the patient. Then Dr. Ushna would be the doctor, and somebody else would be the patient, and then Dr. Moise. Dr. Moise, are you still there?
Hello, I'm
You're still
here.
here?
Sorry.
If you
Yes,
are
I'm
here,
here. I'm so
then
sorry.
okay. Because we're taking turns. So
I'm
Dr.
so
Moise is the doctor. And if anybody of you wants to be the patient, you can be the patient.
I
Then
can
Dr.
be the
Ushna.
patient for Dr. Moise.
Okay. All right. You're going to be the patient for Dr. Moise. And then for Dr. Hamida, any of you want to be the patient, you can. Dr. Ben, can you wait for a while? Would that be okay?
Yes. I don't mind. Yeah.
Thank you so much. So whenever you guys are ready, Dr. Hajra, welcome. I can see you
Okay,
there.
so am I doing a random patient or Dr. Moise is going to choose for me or you're going to choose for me?
You see, I told you that we're doing CVS and I did send a picture. So this list is from Dr. Mo's and Aspires and all the things that have been repeated in the past. You can simulate a patient from stable angina, arrhythmia, pulmonary
Okay.
embolism, chest
All right.
pain, mastectomy, heart failure, whatever you want. You are the
All right.
simulator, but be
So,
the tough one.
okay.
Be the tough
Mhm.
one, right? Because
Okay.
see, anything random, but not the ones that we've already done. If you want to do arrhythmia, you can be, we've done plab1, we know how it goes, right?
Okay, which
So
ones have you done so far? Can you please tell me so I don't do those again?
we've just done costochondritis. Just done
Okay.
costochondritis.
Okay. Okay. I have something in my mind. I'll just start.
Okay. Yeah, keep it a secret, all right? Okay.
Okay, I'll keep it a secret. So,
All
Dr.
right.
Moise, are you
All right.
ready?
Yes,
Yeah,
Dr.
I'm
Moise, are
ready.
you ready?
It's going to be chest pain, right? And you're going to be
Yes,
27
it's going
years
to be
old,
chest
or
pain. You are F2 in the GP, right? And a man, let's say 45 years old, he has come to you and you have to talk to him and address his concerns. Okay.
What's his age, Dr. Ushna?
It's 45.
45. All right, they're 5 years old. All right, okay. There. Okay, we've got the 2 ages there. Okay, Dr. Moise, are you ready?
No,
Whenever
it's
you're
in
ready,
the
I can.
Dr. Hafsa, it's in the GP.
Okay, he's in the GP. All right,
Okay.
he's in the GP clinic. All right, let's start, Dr. Moise. Are you ready?
I'm ready. Hello, good evening.
Hello, doctor. I have this really bad pain. Do something for me, please.
Oh my, I can see that you're in pain. But so I can treat you better, I would like to ask you a question. Would that be all right with you?
Okay, doctor, but just be quick.
Okay, I'll try to be quick. Could you tell me what brings you to the hospital?
Well, I have this really bad chest pain.
Okay. Can you kindly confirm your name and age, please?
Yes, doctor, this is Alex, and I am 45.
All right. So, Alex, you came with this chest pain. Could you tell me a bit more about it?
Yes, doctor, it has been there for the past 20 minutes now. and it's not going away. I don't know what to do. Do something for me, please.
I can see that. If you're comfortable enough to answer my question, we can continue. Otherwise, I can provide you with some medication, analgesic.
Okay, you can continue.
All right, thank you. Okay, could you tell me what were you doing when it started?
I was working in my garden, and all of a sudden this pain started, and it's really bad.
All right, and this is the first time you had such symptom?
Yes.
All right, anything? Does it radiate anywhere?
Yes, it's going to my arm,
Which arm?
my left arm.
All right, and anything make it better or worse for you?
Nothing is making it better, and it's getting worse.
All right. Okay, any other symptom with it besides the pain?
Yes, you can see that I'm all sweaty, and oh my God, it's so bad pain.
Okay. Any difficulty in breathing? Any fever?
Yeah, I have
Any
some
weight?
difficulty. I have some difficulty breathing.
Okay. Any weight loss you might have had recently?
No,
Any limb swelling? Any kind of redness anywhere on your body?
no,
Does the pain increase on or decrease on bending forward?
no, it doesn't.
All right. Do you have any prior medical condition or diseases?
Yes, doctor, I have hypertension and diabetes as well.
Okay. Anything beside that?
No, nothing.
You ever had any DVT or pulmonary embolism? Any clot in your leg or um, your lungs?
No, no clots.
Okay, and you're taking your medication for this hypertension and diabetes, right? Are you compliant with
Yes,
that?
yes,
And
I
what
am
are you
taking.
taking?
I'm taking amlodipine and also metformin.
Anything beside that? You're taking any other medication, or were you taking over the counter or otherwise?
No, doctor, no medications at all.
All right. Okay, this is a common question we ask from all the patients. Do you smoke or do you drink alcohol?
Yes, doctor, I do smoke and I also drink alcohol.
What do you smoke and how often do you smoke?
Doctor, why are you asking me so many questions? I have so bad pain. Do something
Uh,
for that, please.
Actually, I'm
Said
just
you.
trying to find out what might be the cause so I can treat you better. I'm extremely, I can understand that you're in pain. I want to treat you. I want to help you. Just, I want to know
Okay.
what's going on so I can
Yes,
treat you
doctor.
better.
I smoke and I also drink alcohol.
All right. And what do you smoke and how often do you smoke? Just
I smoke cigarettes and I smoke a lot of cigarettes, like 10, 20 a day for the past 30 years.
and what do you drink? What kind of alcohol?
I drink wine, one glass of wine every day.
Right. Okay. Thank you for answering all my questions. I can see that you're in pain, and we're going to do everything in our power to help you out. Just before that, I would like to examine you. Would that be comfortable for you?
Yes, doctor.
If you would like, we can arrange a chaperone as well.
Okay, what you're gonna examine?
I'm going to do general physical examination. I'm doing a cardiac. I'm going to do the cardiac examination. I'm going to do chest examination and
Okay.
anything there. Also, I'm going to do respiratory examination. Anything?
Patient, are you gonna check the observations as well? Patient,
Then I'm going to.
oxygen saturation is a little low.
Mhm, mhm,
It's 97 something, and his respiratory rate is high. And
mhm.
yeah, that's it. He's sweaty on general examination.
Pulse rate, blood pressure, anything there?
Pulse is high as well. Blood pressure is
Okay.
normal.
Okay. I would like to now do chest X-ray, um, heart racing, and complete blood count, liver function
Okay.
test, renal function test, blood glucose level, and electrolytes, basic electrolytes. Anything there?
Doctor, how are you gonna manage me?
Anything there in the test? Nothing? All good? ECG is good?
Well, there is some ST elevation on the ECG.
Okay. All right. From the history you gave me and from the examination, it seems like you might be having a condition where you might have developed a clot in your heart, which is causing strain over your heart. So first of all, I'm going to give you morphine to ease your pain. I'm going to give you oxygen. I'm going to give you aspirin and Plavix just to help with this. Also, we're going to do further tests after that. We're going to do your cardiac enzymes. We're going to do troponin for you. Also, we're going to do further specialized examination like echo and otherwise. Just I'm going to discuss with my seniors. And as this is something I think this is very urgent, so we're going to rush. Is it fine for you? Is it all right? Can we do all these tests for you?
Yeah, of course you can.
Do you have any idea about this condition, about this what you could be having right now exactly?
Yes, doctor, I think it's heart attack.
All right. And do you have any concerns regarding it?
Yes, I don't want to die.
Well, I can see that you're really stressed. Don't worry, we're here. We're going to treat you. We're going to manage you, and we started the management for you. All
All
right.
right. Okay.
Just stay with us. All right.
Okay.
Once you're better, we're going to admit you, and we're going to keep
Okay.
you here for some time. Once all your tests are in, and though we cannot say for sure exactly what is going on at the moment, we still need further examination and test. But for now, as I told you, we started the medication for you, and we're going to wait. All right.
Okay.
Once you're better, once you're good, we're going to uh, discharge you with medications. All right, and we're going to
Doctor,
give you pamphlets and fly. Okay, like what am I supposed to do now? Should I like go to the non-medical management or no?
All right, it's done. It's
it's
done. It's done. It's done.
okay. So,
I,
Dr. Moise, it's done.
she's
Dr.
in ER
Moy,
right now.
uh,
Yeah.
Dr. Moyes, so I'm gonna
Yes.
give you the review, okay? But it's
Yeah.
gonna be
All
a
right.
little hard on you, but I
Yeah. No
hope
problem.
you're gonna take it constructively. Okay, so
Yeah,
the
I'll take it
first thing
positively.
is that I'm sorry for my parrot, he's just being crazy. Okay, so the first thing is that the patient was in the GP, okay, and it is an emergency. So
Ah.
whenever you have a patient that comes to the GP and it's an emergency, you have to verbalize that I'm gonna call an ambulance for you, okay, as soon as you know that it's the case. So in
Okay.
this, the first thing I have written your mistakes down. So the first
Mhm.
thing is that when you started it, you just have to start with introducing yourself. And then you also have to ask about my introduction. Okay.
All
So
right.
that's one thing. And after that, when the patient said that I am in pain, you said that, okay, do you want painkillers? That was good. But you can also say that I'm sorry that you're in so much pain. Then you can say that, are you comfortable to talk right now? You will say no. Then you can say that once we are done, I will just have quick, question and answers with you, quick chat with you, so that we can just know the cause and we can, address it. Then we're going to give you the painkillers. All right.
All right.
Okay,
Anything
after
else?
that, when the
Mhm.
patient comes with the chest pain, so he's telling you that it is really bad, you have to first ask the open question, which you did, then you have to ask the other thing. You didn't ask me about the severity of the pain, okay, and the type of the pain, what kind of pain it is. It's good that you ask the radiation. And when you just knew from the symptoms that it was radiating to the left arm, it was severe, it was for the past 20 minutes, you just have an idea in your mind that it is going towards MI, right?
Yeah. The thing is, the patient was crying with pain, so it was understood. The patient is in
Okay,
pain,
so
really
yeah,
bad pain. Yeah.
yeah.
So I didn't
So
want
when
to
you
waste
know
my
that it's
seconds.
MI, so you
Yeah.
don't have to go for so many DDs. You can just ask
Mm-hmm.
one or two, okay?
Mm-hmm.
You just don't have to rule out other things. You just have to rule out some,
Mm-hmm.
emergencies, which could be. Then
Mm-hmm.
after that, you don't have to ask days at diet, exercise, alcohol. It's an emergency. You don't need to ask those. You're not going to
Mm-hmm.
use them in the management, and they're not going to help you in the diagnosis, okay?
Mm-hmm.
You can ask about the
Makes sense.
medications, you can ask about the medical conditions. You can ask, what do you think might be wrong with you now in the very start? If you would ask me in the start, what do you think might be wrong with you? I would have said that I think it's MI. And once you ask that question, then you ask, why do you think it's an MI? Then I will tell, because my uncle had, heart attack. So ask why. Why do you think so? After that, you have to, once you just know that it's MI, then you just tell him explain him about the diagnosis. Okay, you examine him if you want. Of course, you can examine him. After that, you have to say that, you have to verbalize that, as you have told me this, I suspect it might be this. So I'm gonna call, it's an emergency, and I will have to call an ambulance for you. Okay. And then you can say that meanwhile the ambulance comes, I can give you the Mona, morphine, oxygen, uh, n- the nitroglycerin patch, and aspirin. Okay. And after that, you can just discuss all of the things that could be, and I can also do your tracing of your heart. Okay. Because in the GP, you can only do these things. You said about echo and about other things. So the point is, because we're going to send the patient to the emergency. Okay, are you following me, Dr.
Yes, I'm
Moise?
following you. Yeah. Yes, I'm
Yeah,
following you.
because we have to send the patient to the emergency. Okay, so if we do the blood test in the GP, it will come after 2 weeks. Okay, we don't want that. We don't need blood samples. We will just send him to the emergency, and he will get his results in few hours. Okay,
Right.
so you just do the ECG in the GP. You don't take the blood samples if it's an emergency, and you just give the Mona here, and then you send him. You know. After that, if you have time,
Yeah.
you can say, meanwhile the ambulance comes, we can discuss some things that will be done with you in the emergency. They will take your blood samples. They will do your cardiac, what would you call them? Blood test for your cardiac markers, and they will do blah blah, chest X-ray, and all those things, right?
All right. And what if we were in
So,
A&E then?
if we were in an A&E, then we can just tell him all the management that we are gonna do with him, all of those things. Because we can take this sample of blood and get the results quickly in A&E. We can do the chest X-ray quickly. We can do all of those tests that you want to do.
So was my response all right if we consider I was in A&E?
Um, Well, then you will say that, as you
Yeah.
have told me, that you have a chest pain, which is very severe, and it's going to your left arm and left jaw. And you've also performed an ECG, which shows such and such changes. So we suspect that you might have a condition which is called an MI. We also call it a heart attack. It is decreased blood supply to your heart. And so what
Krishna,
we're gonna do for you now?
can I just
Sorry.
one thing in here? Is that all right if I interrupt? Just one
Yeah,
thing.
of course.
Do we in the UK have ECG in the GP clinic?
Yes, that's what Dr. Moore told, that we have ECG at the GP clinic.
As far as I remember, he just said that we have the basic blood tests and not the ECG. And if there are emergencies, then I don't think that they're going to come to the GP clinic. Because if they are to come to the GP clinic, then they have to book an appointment to even get to the GP clinic. To the Goodwell clinic too, they have to take an appointment. If it is an MI, then a person with an MI would not go to the GP clinic because he'd take an appointment. They'd go to the emergency. All that you're saying is all right, but I guess that the premise is not right as far as I know, as far as I've learned through him and the things that we've been practicing. So I guess in that, yeah, we do have walk-in OPDs there, as Dr. Hajra is saying. According to that, that's fine. But if it's an emergency, then definitely most of the questions would be in the emergency. Otherwise, all the things that you said, I was just wondering if the ECG is there. Dr. Hajra, is there an ECG in the walk-in clinic? Because the walk-in and the good man or good woman clinic, we do have stuff there. But when it's an emergency situation, most of them are going to come to the emergency because we'd have to manage them accordingly and maybe manage it because it's an MI. But that's what I learned, and that's what I was thinking. Otherwise, all the feedback that you gave was amazing.
Yeah,
So,
but
like,
actually, so many people asked him this question about the ECG, and because he told us that sometimes they send MI to the GP clinic, and then so many were asking in the comments that can we just do ECG in the GP? So he said that yes, we can do that. So we can just confirm it with him. I'll just confirm it with him.
Yeah. The thing is that when I watched it in his mock and I did ask him again, so he did say that, the emergency cases are most likely not to come to the GP clinic because it
Yeah.
turns out, it kind of obvious is like, not in like in our countries, but in UK, they do have to make an appointment with the GP. And if a person has an MI, he's not going to have time to make an appointment. As you said, that it's going to take around 2 hours for the blood results to come in, or maybe he's going to come back and he's going to get the blood results. Like for chronic things, the GP clinic looks fine. Otherwise, the things that you were telling him, that's right, because we told him, Dr. Moyes, that it's a GP clinic, and he did not remember that. So that's the important thing, that where you are, who you're talking to. So the feedback was on spot. Just my query was that whether in GP clinic we're going to have this.
Yeah,
And if
you're
so,
right. But it has happened past few times that an emergency came to the GP clinic in the
Yeah.
plab exam. So that's why
Good.
Dr. Mo told that you have to be careful for an emergency. So you just have to call the ambulance right away and, just send him there.
All right. Thank you so much, Dr. Krishna. I didn't know that.
Okay.
One
Yeah.
thing I want to
Yes,
know, excuse me,
It's
in such emergency cases, like, are we supposed to be dramatic?
you're supposed to
No,
be natural, I guess.
no, you have to rather stay calm.
Not
If the patient
dramatic. No.
is not
But
calm, you
by
have to still
dramatic, I
stay
mean,
calm.
yeah, like by dramatic, I mean we have to be like rushing. We're
No,
going like,
no.
or we should be saying, okay, you have a heart attack, no problem. We're going to treat you. You're not going to die. It's all right. Or should I be saying, we're going to hurry, don't worry. We're calling him 911, don't worry, like this. What we're
If the
supposed to
person
be.
is and he has an MI, as Dr. Ushna says, I guess you are supposed to, get in the and tell them that we're going to call it an ambulance. As Dr. Ushna says, all the things she said was, I agree with him, all of them. And that was right.
I have a question.
Thank you. Thank you, Dr. Hafsa.
No, I still have to say some stuff. Yes, Dr. Fatma.
Thank you, Dr. Ushna.
Yes.
You're
So, like
welcome.
you mentioned, when the STEM comes in the exam, will we know where the patient is coming to, like
Yeah.
whether he's at the GP or is at the is in the emergency department? Because here
Yes,
in the
yes, yes.
notes they just say like is
Yeah.
the patient presented to the hospital.
No. They would definitely say that they are in the accident emergency or in the GP clinic. So they'll definitely tell us. It's going to be a note outside and they will tell us.
Yeah. Okay. Thank you.
Yes, Dr. Moyes, because she was simulating an MI, I don't know if Dr. Ushna is here or she left because she said that she did awesome by being a very good kind of patient, and she simulated it so well that she started off by crying that I have pain, and she didn't even wait for you to ask her, that you were supposed to ask her name and you forgot because it was kind of dramatic. Well, the thing is that you asked her that, am I right, you're going to have this pain, etc., etc. Then sight is important, and you asked that question, which was good, and then you're going to call the ambulance, which was an important thing, but which you would say immediately after you scale the pain, right? In the Socrates bit, I think you forgot to ask the character. You did ask the radiation, I guess, but you forgot to ask the character and the severity. Did you ask the severity on the scale of the pain? Dr. Moyes, are you there? All right, I don't know if you can hear me, but I think that
Are you talking to me, Doctor? Dr. May, or you
Dr.
told
Moyes.
another name?
Dr.
Moyes,
Moyes.
okay.
Yeah, I don't know if he's here or not.
Yeah, I'm here. What happened?
I'm saying that did you do the pain scale thingy?
No, I didn't. I just
This is
didn't do
this
that
is
because she was already saying, I'm in pain, I'm in pain. It was
yeah,
obvious from her like
scale.
sound. She was going to say 8, 9. At least she's going to say like that.
Yeah,
What
you
were you
have
going
to
to
do
say,
the scale.
doctor?
Yeah, I'm
Doctor, you're
saying that
gonna
if you do
yeah.
scale, then you wouldn't know the severity. And if you know the severity, if the patient said that they are in pain right now and the severity is 8 or 9, then at that very spot, you're going to say, I'm going to call an ambulance. Meanwhile, as soon as the ambulance arrives, we're going to send you to the emergency. Meanwhile, I'm going to ask you further questions, and I would try and manage and decrease your pain, right? So that at very point, because that is when, like either after the PC, the presenting complaint, you should concern, right? And one thing was that, you were asking 2 questions at a time, right? Like you were saying, do you smoke and do you drink? don't do that together. Dr. Miss, we've been doing it before as well, right? So don't do that
Yeah.
together. And if you said that, they don't want to talk about the drinking and smoking and etc., you'd be right. All right, don't bother the patient if he's in pain. If he says he doesn't want to answer, all right, you try, right? If they don't want to talk about it, don't insist on it. Because, the person's in pain of an MI, don't insist on asking them. That's what I think, because that is humane way to deal with it. The person in the emergency is going to definitely ask them if they have pain, right? So, and your management, it was good. All of it was good, but it was just in one paragraph. The person who is in pain of an MI, who has a pain for, like, say, around a scale of 9 or 8, and you're telling them everything in one go, I don't think that the person would understand. But if they say that they do understand, then they're just doing it for the sake that you would stop talking, right? So very important that don't say all of it in one go. That's just what I wanted to add to what Dr. Ushna already said, right? Like, don't say everything in one go.
All right. Thank you, Dr. Afsar.
All right. I hope that wasn't too harsh, but I guess Dr. Ushna
No,
covered.
true.
Okay. All right. So Dr. Hamida, you wanted to do next, right? You wanted to be the doctor, right?
Yes, please.
Okay. Anybody wants to be the patient? Or who wants to go next?
I can be.
Okay, Dr. May is the patient and Dr. Hamida is the doctor. Dr. May, you know the premise. You can do any of it. You can do herpes zosters, like arrhythmia, pulmonary embolism, heart failure. We're kind of revolving around that today, right? MI, like the sinister thingies, all right? Okay?
Okay, doctor.
All right. So whenever you guys are ready, I'm going to start the timer.
Okay, so just to be clear, doctor, where are we? A&E or GP or Dr. May?
That depends on what Dr. May wants to do. Dr. May, where do you want this patient to be and how old?
I'm choosing a station to Dr. Baha. Give me 1 second, please.
All right. Take your time.
Choose wisely, Dr. May.
Okay. Look well, no? Dr. Nichols would be next. All right, Dr. Nichols.
Okay. We are in a GP clinic. Okay.
Mm-hmm.
Okay.
How old is the patient?
57.
All right. Okay.
57. Okay.
Shall we
Should
start?
Yeah, definitely. Whenever you guys.
Mr. Alexander, 57, presented to the hospital complaining of chest discomfort. This is the patient first visit. Talk to the patient, take history, discuss initial plan of management. Do not examine the patient.
Do not
The system
examine.
says that.
Okay. Just discomfort, GB 75. Alexander. Okay, I'm ready.
Mm-hmm. I'm ready to.
Hello, is this Alexander?
Yes, doctor.
I'm Dr. Ben Hamida, one of the doctors in the clinic today. Can I confirm your full name and date of birth, please?
I'm Alexander Mark. I'm 57-year-old.
57. And is it okay to call you Alexander?
Okay.
Okay, so thank you, Alexander. So what brought you to the clinic today?
Well, doctor, I've had this terrible chest discomfort.
Are you comfortable at the moment?
Yeah.
Okay, Alexander, can you tell me a bit more about symptoms?
Well, doctor, it started 6 months ago, and I was doing nothing. Okay, and it's kind of I don't like vibrating sensation. I couldn't mimic it. I don't know how to tell you about that.
Okay, okay, that's fine. Okay, so you've mentioned it's been around 6 months now, and
Yes.
is it like on and off, or is it continuous?
No, on and off.
On and off. And do you have maybe any idea what might, triggers these symptoms?
No, doctor. I don't think
Mhm,
so.
mhm. Okay, okay, that's fine. And is there anything might increases the symptom?
No, doctor. You mean the trigger? I don't have any idea about anything triggering that.
No, no. I mean, is there anything that might increases this discomfort? For example, when you do any heavy activities, for example.
No, doctor. It
Mhm.
came on its own and goes on its own also.
Okay. And what about rest? Do you have these symptoms at rest as well?
Yes.
Okay. Okay. And apart, from this discomfort, is there any chest pain?
No, doctor.
What about any cough?
No.
Any difficulty in breathing or like breathlessness?
No, 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 doctor.
What about, like heart racing, for example?
Heart racing. I think it's goes along with that chest discomfort. It's yeah, doctor.
Okay.
I feel like it's a fluttery.
Fluttery.
My
Fluttery.
heart is
Okay.
yeah.
Okay. And whenever you get the symptoms, do you feel like feeling sweaty as well?
No, doctor.
What about any lightheadedness?
No, doctor.
Okay, so Alexander, taking these symptoms, have you had any thought what might cause these symptoms?
But doctor, I'm afraid I had a heart attack as my father.
Okay, I'm sorry about your father, but may I ask why do you think it's a heart attack?
I don't know. I think that a heart problem runs in families. So he died of a heart attack. So I have several ideas about my condition.
My deepest condolences, Alexander. But we will have to do further investigations to rule out any heart issues. Would that be okay?
Okay.
Okay, so Alexander, 6 months, it's a long time. So how you were coping with this discomfort?
Well, doctor, to be honest, it's not affecting my job many. I mean, my office job. I had office job. I didn't do that much activity that can affect.
Okay.
Can be affected.
And what about your life in general? Is there any stressors?
I think no.
Okay. Okay. So Alexander, have you ever been diagnosed with any medical conditions in the past?
Yeah, doctor, I have a high blood pressure.
High blood pressure. Since when?
5 years ago.
Are you taking any medications for it?
Yeah, Ramipril.
Okay. Are you compliant with the medications and the GP follow-ups?
Yeah, doctor.
Brilliant. Very good, Alexander. And apart from your high blood pressure, is there anything else?
No, doctor.
Any medications or over the counter or other than the Ramipril?
No.
Okay. And regarding your lifestyle, Alexander, if I may ask, because some people, when they have such symptoms, they usually tend to smoke or drink. May I ask if you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay. Okay. So, Alexander, you've mentioned that you're concerned about having a heart attack. May I ask, or maybe did you give any idea, or are you hoping for anything from us today?
No, doctor. I want to know what goes on with me.
Okay, we definitely will need to do further investigations and to do heart tracing to check and make sure the heart is functioning well. Would that be okay?
Okay.
Okay, so you know, from my assessment, Alexander, and from the symptoms you described, there are a couple of things that, you know, can participate in such chest tightness. One of them, to be honest, is related to the heart muscle. Okay. And
What do you mean by that,
sometimes,
doctor?
yes, sometimes when people, you know, are experiencing such symptoms like chest fluttering, we usually tend to think about a condition called arrhythmia, which is basically, you know, irregularity in the heart rhythm.
Ah, okay.
So,
They're
would you
related
like
to attack, doctor?
Well, to be honest, we need to confirm this and start right away with our management to rule out any possibility of future chances of getting a heart attack. Time's up.
No, continue.
Still time. Keep going.
Okay, so would you like me to tell you what we can do for you now, Alexander? Okay, so since I'm suspecting this irregularity or the rhythm irregularity, I would like to refer you to a heart specialist who will do further investigations and, you know, just to confirm the diagnosis and discuss with you further management plan. How's that sound?
Okay, doctor.
Okay, and there are a couple of things that you can do at home, you know, to try to make this symptoms like goes away or
All right. Dr. Baha, the time.
Brilliant, Dr. Baha. Brilliant.
Yeah.
Sorry?
Anybody wants to give review to Dr. Baha?
No, I had to talk about lifestyle and stressors and.
You did amazing, by the way. You did awesome. According to me, as far as I know, your acknowledgement was good. You were reflecting on the patient's words, and you were actively listening to the patient. Your structure was good. It was all amazing, to the point. Just one bit I noticed. Is, and you know, the way you involve the patient while, you know, asking about that. It's been so long. Why did you come today? That was amazing. I think we should all be learning from you the good signpost. And even if somebody is signposting about the smoking and alcohol, the way you did it, that's how we're supposed to do. That's what I've learned. That's what we've learned from Dr. Moore, right? And from other teachers as well. And just one thing that I noticed was that at the end, you were pushing the patient. When the timer said 2 minutes, that's when you were pushing the patient. You were rushing him. Don't do that. When you do an amazing.
I actually didn't notice that. Can you tell me, like, for example, when did I exactly did that?
Yeah, the thing is that, you know, when you were telling the patient that, you know, I'm going to do this and this and this, kind of like you were doing amazing, but kind of involve the patient in, right? Like every time you give him a suggestion, maybe after 1 or 2 suggestions, you could just, you know, involve the patient, right? Involve the patient. And then, like, when you were talking to the patient, and the patient, you know, like, told you that I've got this and this, and he was kind of concerned, you did the idea at the right time, the concern, the expectations at the right time. When the patient said so, and, you know, like, he felt a little low, because, you know, we have to also, because you did amazing. This is why I'm giving you this kind of review. I'm not a teacher, just trying to learn with all of you guys. But like, when she sounded a little low, how about you know, like, give encouragement to her, that we're here, we're going to do everything fine, just like sense it. That's a non-verbal cue, that the tone goes down. I guess that's what she was trying to simulate. I'm not very sure if Dr. May was doing it, but I guess that's what she was trying to simulate. And just at the end, like, involve her more. Like, if you give her a suggestion, I'm going to send you to a heart specialist, involve her. I'm going to treat you with this, involve her. Just at the end part, involve her. Otherwise, your IPS, your history, your management, all of them were brilliant, according to all of us, I guess.
Okay, and it's arrhythmia, right?
Dr. May,
yes.
right?
Yes, and what we can do apart from referring to the specialist? Lifestyle advice?
Lifestyle, and maybe you give the patient propranolol at the moment. I'm not sure of that, but The main point is if the patient is drinking too much coffee, too much caffeines. I mean,
Mm.
I have to ask about regarding to then the stressors, okay, and you will refer him to the specialist and safety net of myocardial infarction if it happened.
Okay, so my question is, which is better? Talk about lifestyle and stressors first, then talk about the referral, because you know I've seen Aurora today, IBS seminar. He said, you know, rather than treating the condition, treat the situation.
Yes,
Yes.
yes.
As an
Depends on the.
Our job as an FY2 is to, you know, stabilize the patient, right? So treating the condition is definitely there, stabilizing. If the person is in GP clinic, right? She came in GP clinic. You can do both, depending on your expertise, right? Where FY2s, we could say that, you know, we're going to involve the senior, and that way we can go about it. That's what I think.
Okay, and the question said, do not examine the patient. So I will not verbalize this, but should I do investigations? Should I do like heart enzymes and?
If it says do not examine, that means you're not going to even touch the patient. You wouldn't even say, I'm going to check GP, I'm going to do your GPE, check your blood pressure, etc., nothing. If it says do not examine, do not examine.
But what about, you know, like cardiac enzymes and ECG? Will I do that? The investigations.
That's not examination, that's investigations. I guess you can do that. That's what I think. Yes. Oh, you did. One thing is that, you know, the patient has palpitation, right? So maybe we could also exclude the things about, you know, like the panic attack, the thyroid, right? And tea, caffeine, energy drinks, as Dr. May said. So, you know, and
exactly.
Did you ask her that if she's before?
I think I did. I'm not sure. I was only thinking about you know, the heart issues. I totally forgot about thyroid. And
so I guess that is one thing that we're learning here, that you did amazing, but the thing here to add on is this, that, you know, you could maybe, because, you know, she is 57, so yeah, don't ask the expectations at the end. Dr. Harger is right. Yes, Dr. Harger says that do not ask the expectation at the end.
I shouldn't ask it in the end.
The expectations bit, I did ask Dr. Mo the other day, and he said that the expectations that you should ask are immediately after you examine them, right? If you're yeah, and if you're not examining them, then when would you add the expectations? Just before you give them the provisional diagnosis, not at the beginning, right? Like expectations just before you give it to them. That's what I think, right?
Okay. So if there's examination, I should ask after the examination. If not,
like
then
at the end of the history. After I think that after presenting complaint, ask the concern, like, what do you think is the worst? Because that'll just lead you to what they think, right? And at the end of the, you know, whole history, you can ask the expectations, right? And ask about the idea just before you give the provisional diagnosis, right? Like if they have any idea of what's happening, right? Like it's not ice in the way of ice. I think you have to start with concern. Then after you're done with the history, you could do the expectations. And at the end, before you give the provisional diagnosis, ask the idea, right? Like that just makes sense, that if you are having a person who has got some presenting complaint and you were concerned and they came here and you want to know what they are wondering about, then you could just ask concern there. And if you ask expectations just before doing the management, that is like at the end of the history, that'll help you in, you know, the management. That what do you want them to do, right? They'll say that I want you to see if I have a heart attack or not, if I'm going to die or not, right? So they'll just help us in management. And I guess the idea, you could just ask directly before the provisional diagnosis. No?
Okay.
Hello, Dr. Hafsa.
Hi, Dr. Hajar.
Yeah, I'm still confused about this whole ICE expectations, everything. And the only thing I have is what Dr. Hamid has taught so far. So actually what I understood was that your idea about like disclosing, do you have any idea about the diagnosis? Like after you disclose the diagnosis, you can ask afterwards. That plays a good role because then you can, gauge like how much.
Not after you, sorry, I'm sorry for interrupting.
Yeah.
Not after you disclose it, but before you're going to disclose, right? Like before you disclose, let's ask them what's your idea about it.
No,
right? Like if
that's what I'm coming up to. That sounds a bit, what Dr. Hamid said was that it sounds kind of like bad because sometimes the patient can come to you and say, you're the doctor, you're supposed to know. Like some patients can actually reply like that. So that will play very bad for you. So rather than that, you can just tell them, okay, you have angina, and then you can say, okay, do you have any idea about it? So they can probably tell you, okay, I read this document in NHS, I know, or they could say my mom had angina or something, or they could say it somehow like they have an idea. So then you could say, okay, do you want me to tell you like how it happens, or do you want me to tell you some tests that we can do for like something like that? So I agree with the point that you tell. Yeah.
All right, I'm sorry to interrupt. I'm just trying to get the hang
No
of it.
worries. No worries.
Like if you tell them that you've got angina, then you ask them, do you have any idea about this?
Yeah.
Then you ask the thing that you told them. You're not even asking if they have the idea about what is going on.
No,
right?
that's the thing. That's the thing. We've been doing this like way longer. So I know it's in your mind and it's in my mind as well. But that's the wrong approach. We're not supposed to say, do you have any idea? Because you see, like when we go to the doctors, like when has a doctor told you, do you have an idea of what's going on? Nobody
they don't
says that.
even know what's the name. They don't
Yeah.
even
Because it doesn't sound like a smart, it's not going to sound like as if you're a very smart doctor or a very confident doctor. So that's going to play really bad for you. That's why I'm kind of emphasizing again and again, because you have it in your mind as well. And it just, makes me feel bad because I know some things I just want to tell you guys. So first of all, when you say the diagnosis, then you can ask, because the UK people, they're smart enough. They are Googling a lot of stuff. They're reading up on NHS materials freely available to them. So that's what Dr. Hamid keeps telling us. But we should ask them. Why? Because if they already know about angina, you're going to be wasting your time explaining it to them. Rather than doing that, you can move to something else. You can tell them the risk factors. You can talk about something else, right? But if you talk about it and then you later out find out that the person already knows, then you've wasted your time. Secondly, about expectations, I have a big problem with that question, because you're not supposed to, like, when you go to the doctor, why are you going? The expectation is already there to make them feel better. So you're not supposed to ask about expectations. Whatever expectation they do have, they are going to vocalize it. But you have to give them the moment to vocalize. Like when you're going to be talking about something, like maybe you're talking about angina and you're explaining the pathophysiology and you pause for a bit, they might say, so am I going to die? Or like, what are you going to do for me? So simulators have been taught to actually help you on the way, because they will direct you towards the conversation they want to have, rather than you churning out your theory and then asking them later, okay, what's your expectation? That's going to sound like you're reading a book to them, and they're not going to be happy with you, and they're not going to help you out, and you're going to lose marks. So it's better to give the patient to talk. That's the way that you're going to actually develop a two-way conversation very effectively, because we do that really well in the data gathering part, but we don't do that well in the management. And the only way we can make it better if is like after every statement, we pause for a bit, see, look for the cues. Okay, are they understanding us? Ask, like, do you know any, like, about the diagnosis, right? When I ask, okay, she knows about angina, so I'm not going to talk about angina anymore. So maybe I'll say, okay, do you want to maybe understand what investigations I can do for you, or how I can help you further? Do you want to understand the treatment plan? So that's how you take the conversation. They might say, okay, talk me through the treatment plan, talk me about the complications, something like this. So this will guide your, your narrative with them. So
basically what I'm trying to say is that if they don't help you, then you can use the ice thingy.
Exactly. That's the last resort. That's not the first. Yeah.
What you're trying to say is that, like, give them the space to talk.
Exactly.
But if not, then you can definitely use a concern thingy, like before the, like at the part of the presenting.
If you only say concern when you see the patient getting anxious, or maybe he's looking down, he's no longer replying to you. So then you can say, okay, I see that maybe you're a bit maybe, you know, sad or depressed about this? Do you want me to help you about it? Do you want me to tell you something that's going to help you, or what's got you worried right now? Do you not like the treatment plan? And, you know, towards the end, towards the management, you're supposed to be going like involving the patient so that you understand their lifestyle. So you make a management plan according to their lifestyle. So at the end, you're supposed to say like, okay, does this sound good to you? Does this sound something you can do? Like, you know, get the acknowledgement from them that they're actually going to do what you're saying. Yeah,
Okay.
don't go for like, what are your expectations? I mean, I don't know, but that line, whenever anybody says it, I'm like, dude, don't do that.
But then is the way Dr. Baha verbalized and asked the patient about the concern thing, if he can do that again, like maybe then, you know, we'd have an idea about where I think.
I mean, Dr. Baha is the most confident person who's done this. His experience talks in the way that he's just taken history. That was excellent, far excellent. So when he said expectations, I was like, don't throw yourself under the bus, because overall it was really excellent. But he comes to that point and you're just like, why did you do that? Like, there was no point in doing that. So that's what got me a bit concerned. Like, okay, don't do that. The rest was excellent. Yeah, that was it. That's from me. That's it. Thank you. Thank you so much.
No worries, Dr. Hadra. I think you did raise a good point, and I guess that we learned a lot from this. So, Dr. Hadra, do you want to be the doctor? I guess somebody else wanted to be. Dr. Nichols.
I can be the doctor or the patient, anything, whatever it suits.
So you can be the patient. Dr. Nichols, are you there? Do you want to continue?
And then now I'm nervous because I really don't know about this ice thing. It's just confusing me.
Don't do it. If it's confusing, don't do it. Yeah, don't do it. If it's confusing, don't do it. Follow your instincts and you're going to get there, right? If it is important, you're going to get there.
Okay. Yeah. This is my first time doing it, so being a doctor. Normally I'm being the patient, you know.
The doctor, you've always been the patient, and I love when you are the patient, you know, like you get the toughest kind of thing to go about. Like that. Okay, so Dr. Hadra, do you want to be the patient and let Dr. Nichols be the doctor? Would that be all right with you?
Yes, that's fine.
Okay, so whenever you guys are ready, I'll just start the time.
Yeah, I'm ready. Wait, can I get the patient's name?
Just give me 1 minute. Just give me 1 minute.
Okay, no problem.
Okay, so the patient can be 35 years old. And can anybody hear me? Okay. Hello?
Yes.
Yeah, so I can be 35 years old, and my name can be Malik.
Okay,
that's it. And I'm in the GP setting.
Okay, you are in the GP.
Mr. Malik. Okay.
Yes.
All right, guys, whenever you're ready, we can.
Yeah. Hello? Yeah.
Yes.
Can you hear me?
Yes.
Okay.
Yes. All right.
Hello, good morning.
Hello, good morning.
Is this Mr. Malik? Is this Mr. Malik?
Yes, doctor.
Hi, Mr. Malik. Can I just confirm your age?
Doctor, I'm 35 years old.
Nice to meet you. How can I help you today?
Doctor, I have been having this chest pain for the past month, and it's been quite difficult to, get to work with it.
It's been quite difficult. Is this the first time you're having a chest pain like this?
Yes, doctor.
This is the first time. And you said it's been going on for a month. Can you describe the character of this chest pain?
Doctor, it's a bit like a pull that I feel on my muscles on the front, and it gets really difficult to breathe with it.
You have difficulty breathing. exactly can you point exactly where is this chest pain? Is it central? Is it on the left or on the right side?
Doctor, it's on the upper end. It's like on the left side.
It's on the left side. Okay. And then on a scale of 1 to 10, with 10 being the worst amount of pain and 1 being the least, how will you rate the severity of this pain?
Doctor, about 6.
It's a 6 and 10. And has it changed in character, or has it been a constant 6 and 10?
It's getting more severe now. It was a bit dull before, but now it's a bit more.
Okay. And you had this for a month. Did anything make this pain particularly worse or better?
Doctor, I go to the gym a lot, so I'm thinking maybe it's because of that, because I do a lot of exercise.
Okay. So have you taken anything to relieve this pain?
Yes, doctor, I did take Panadol for the month. I was taking them every day.
Every day. Okay. And did it relieve it?
Yeah, not just a little bit, not so much.
Okay, not so much. Okay, I understand. And you said that you were also having some difficulty breathing when you have the pain. Is that correct?
Yes, doctor.
Yeah. Is this difficulty exacerbated when you when you walk longer distances?
Yes, doctor.
Yes. And do you get it just after the chest pain, or do you get it during the chest pain?
It is at the same time. The chest pain and the shortness of breath is at the same time.
Okay. And have you noticed any associated nausea, vomiting?
No, doctor, just the pain.
No,
yeah.
just pain. No fever, no coughing.
No, doctor.
No. Did you notice any weakness along the left upper left limb?
No, doctor.
No. Okay. Do you have any particular concerns?
Doctors, just that it's just getting unbearable, and the Panadol is not working anymore, so I need something that's stronger.
That's stronger. Okay. So you'll try to figure out exactly what's going on. I'm going to ask you some further questions. Do you have any underlying conditions, for example, high blood pressure or diabetes?
Doctor, I did have a high cholesterol issues. My GP did tell me, and he did put me on some medication for it.
Do you recall what this medication is?
No, doctor, I don't remember, but it's just like one pill that he gave me to take.
Okay, that's fine. Any recent surgeries?
No, doctor.
Any trauma to that particular area apart from what you're describing here to me?
No, not as such. I just do the daily gym and everything, so that's about it. Yeah.
Okay. You said apart from the one pill that you're taking, are you on any other medication apart from the Panadol and this one pill that you take?
No, doctor, nothing else.
No. Just going to ask you some questions that's more specific to your lifestyle. Do you smoke?
Yes, doctor.
What exactly do you smoke?
I smoke cigarettes.
You smoke cigarettes? And how often do you smoke?
I smoke every day.
Every day. And is it a full pack?
It's 20 cigarettes per day.
2 cigarettes per
20,
day. Okay.
20.
Sorry. My apologies. And do you drink any alcohol?
No, doctor.
Okay. Just to backtrack, have you been lifting any heavy equipment as the pain has gotten worse? Have you been over I forgot the word. Have you been lifting any heavy equipment?
No, doctor. All I do is the treadmill.
All you do is a treadmill. Okay. So I would like to do some examinations on you. Is that okay with you?
Yes, doctor.
So I like to do a blood pressure on you, your pulse. I would like to also check your respiratory rate. I'm also going to do an ECG, cardiac exams, listen to your chest, as well as your
Blood.
hello.
Yeah.
Hello?
That's not from my end. Sorry.
Hello.
So yeah. So blood pressure is high and everything else is normal.
Your blood pressure is high and everything else is normal. Okay. Okay. So, Mr. Malik, unfortunately, I'm not too sure exactly what's going on with you. So I will have to review with my senior to get a clearer understanding as to what's going on. In the meantime, I will also discuss with my senior in terms of conducting further investigations for you. But based on the information that I would have ascertained from you, it seems that you have more of a musculoskeletal condition because of the over gymming. But you said that you mainly do treadmill. So.
Doctor, what do you think is wrong with me?
I'm honestly not too sure. That's why I say I will have to review with my senior, just so that we get a clearer understanding.
Okay, but what test are you going to do for me?
So I'm going to do an ECG. I would also like to do cardiac enzymes. I would also like to do a chest X-ray, just to rule out any insidious.
Okay, doctor.
Yes, Dr. Hajra, you want to review?
Yeah. So overall, I think it was good. I mean, the structure, everything, she took it to the right point, but yes, she did get confused. But the actual thing was that this case was something that you won't be able to diagnose. And the trick was not to say, unfortunately, which you actually did. This is the thing that I didn't want you to say, but you actually did say that. So never say, unfortunately, to the patient. He's not supposed to know that you're confused. You could have went with like, okay, you could have chest pain because it's a musculoskeletal thing, or you could be having unstable angina. It's not showing up right now. We could run a few more tests. We could do that, but don't say unfortunately. But overall, the start was perfect. Everything was good, but you did miss out on a very key element. If you had asked me, when do you have the pain? How frequently you have the pain? Like your Socrates, a bit of it was missing. That's why you didn't pick up that it could be angina. It could be the unstable angina. And I did give you a hint that, I'm having it and I'm also having shortness of breath, but I was masking it with 2 diagnoses because that could happen.
Yeah.
I was masking it on purpose. So yes, I left the ambiguity in your head, but then I did give you a way out. I did say I'm doing treadmill and I'm not doing any, so the treadmill wasn't going to cause the chest pain. So yeah, but it was supposed to be like a ambiguous one because we could end up with that, and we're not supposed to say, unfortunately. We're just supposed to say, okay, so you could be having this and you could be having this at the moment, and you're supposed to explain the 2 diagnoses, and then you're going to say that I'm going to also consult with my consultants and get back to you, but in the meanwhile we're going to do these tests with you. So just like I'm going to arrange this appointment with you or that, and that's about it. So yeah. But I did confuse you on purpose. So yeah, sorry about that.
Yes. To be quite honest. So what were the tests that I would have had to say?
You could have done the ECT as well in this case, because the person was saying, he's having shortness of breath during the treadmill gym. So ETT was the best one. And we could have gone for another ECG and cardiac enzymes. Those were perfect. The examinations were fine. And you did do the chest examination, so that was fine. But Otherwise, it was just a management part that, that was just a bit lacking, but overall, I think was fine. And you did miss a bit on the pain history. So
Socrates.
yeah, so you would have to revise the Socrates again, because you did miss that it would be unstable angina if you didn't even ask the timing and everything, but that's fine. We are all here to revise together.
Yeah.
That's true.
Yeah, that's about it.
Because why do you think you missed on the Socrates?
Sorry?
Why did you miss on the Socrates? Like
I
history?
don't know, because I have it drilled in my head, Socrates, but like thinking it through and saying it out is like two different things.
Picked up on it. You know what? You want to know why? Because you did not start with an open-ended kind of question. You went on about and asking them that, where is it? And when does it start? Like, ask them to, because as Dr. Hajra has been saying, that the simulators have been trained to say things and they want to help us. So like, start with an open-ended thingy. When you do that, then you have the time to think about what am I supposed to ask in the pain, right? Like the site, the onset, the duration, when does it happen, is it continuous or not, right? So that's one point. And I guess that before that, Dr. May did the same thing, and I guess Dr. Moore all the time. So that's one thing that would definitely become in practice. Apart from that, as Dr. Hajra said, it was all good. Just as Dr. Hajra said, being honest is important, right? It's really important, right? So you could say, instead of saying, unfortunately, I don't know, you could say that, all right, here are some things that we think you might be going through, right? Then explain them. This could be this, like at least give them 1 or 2 or 3 diagnoses, like differentials. And then you can say, I'm going to involve a senior, and then, we're going to run some tests and we're going to get to the bottom of this. But at the moment, this is what we're going to do. Right? Like, don't tell them that, you don't know. You don't know, but you're going to tell them this is what it is, right? This is what we could do. That's what I think I did, apart from what Dr. Hajra said. Dr. Hajra, do you want to be the doctor now?
Yeah, I
Or
can
anybody
try,
else?
and everyone can just make fun of how much bad I am at it.
No, why would you
want me
say
to
that?
be patient?
Yeah,
Yes.
I'm gonna be bad at it. I haven't done any practice with anyone.
Question about the management of the unstable angina and also the timing of the pain. How do we diagnose it?
How do we diagnose the management of the angina and the time of the pain?
You said that she missed some points in the Socrates about the timing of the chest pain. When does she get the chest pain? So as to diagnose the patient with unstable angina.
Yeah, like.
Sorry, I can't hear you.
Like she could ask that at what time. I don't think she asked on that. Did you ask her, Dr. Nichols?
Dr. Hafs, I haven't heard what you said, and you're going in and out.
Sorry, I think I understood what Dr. Rewan, I think, is trying to ask. Like, I wanted her to ask me the nature of the pain. Was it continuous? Was it intermittent? Because she didn't ask it, she didn't get to know that the pain was actually intermittent. And if she had gotten that, that would be a clue towards unstable angina.
Yes, okay.
I hope that's clear.
Yes. And what about the timing? When is the unstable? When does unstable?
I would have said that the pain occurs randomly. Like, I wouldn't have said that there's a specific time for the pain to occur.
Oh yeah, okay, not related. You mean to exercise or any exertion?
Yeah.
And then will be the stable angina, right? Like if it is related to the exercise.
Yeah.
Okay.
Okay, so is there anything special regarding the management of the unstable angina? I'm sorry.
No, that's all right. Like you're asking what we're going to do in the management. I guess that she was just telling him what she thinks, right? So in the management, obviously, if you're thinking an unstable angina, you're going to go for the exercise tolerance test. Then you're going to repeat an ECG, cardiac markers. And if she's still having the pain, you'd give them a painkiller, maybe a nitroglycerin, and involve the GP, and then like send them to the heart specialist. Then you could do the safety net, and by saying that I'm going to if you have these symptoms of MI, because if the person has got acute coronary syndrome, then definitely we're going to septinate regarding MI, embolism. MI is like really, really important in these cases, right? So I guess that's how you'd move about with the management, because the management has 4 or 5 parts, I guess. Like you have to admit them depending on how the condition is. Then you have to, like talk about involving the senior, then manage them medically and non-medically, and like end up with septinating. I hope I'm not missing something.
Yeah. Thank you, Doctor. Yes.
No worries, Dr. Atta. So, Dr. Hajar, you want to be the patient, the doctor, right?
Yes, I want to be the
Anybody
doctor.
wants to be the patient? Dr. Aristi, Dr. Nazik, Dr. Asha, Dr. Ben, Dr. Baha, Dr. Moez.
I could be the
Anybody?
patient.
All right, Dr. Nichols wants to be the patient. All right, Dr. Nichols. So whenever you guys are ready, I'd start.
Well, what kind of patient, your age and your name?
Age 42. Name Chester. Chester.
Chester Pennington, right? Yeah.
Great. Okay.
And we're in a GP. Yeah.
Okay.
Okay. Are you ready?
Yes, I am.
Okay. Hello.
Hi.
Let me just start the timer.
Okay.
Yeah,
fine.
that's okay. You guys are excited, I guess. All right, here you go.
Hello. Good morning.
Good morning.
How are you today?
I'm okay.
Can I confirm your name and age, please?
My name is Chester, and I'm 42 years old.
Okay. How may I call you? Is it fine if I call you Chester?
Yes, that's fine.
Okay, Chester. So how are we doing today?
Doc, to be quite honest, I've had this burning pain in my chest.
Okay. Can you tell me again? Sorry, I didn't catch you. What kind of pain is it?
What kind of pain? I didn't catch.
Somebody needs to be muted. A burning pain in my chest.
Burning pain in your chest. And for how long has it been?
It's been there for, I would say, roughly a month.
Okay. And where exactly is the pain? Is it on the upper side or lower side?
It's more central.
It's on the central side. Okay. And does it radiate anywhere? Does it go anywhere?
Sometimes I feel it going up into my throat.
Up into your throat. Okay. And does it get worse at any point in the day?
Oh yes, definitely when I eat foods like my diet, my normal diet.
Okay, and what do you normally eat that makes it worse?
Well, I eat with a lot of seasonings and spicy stuff, spicy seasonings.
Okay, and is there anything that makes this pain a little better?
If I drink water.
Okay. So any other symptoms that you have other than this burning chest pain?
I sometimes feel like I belch a lot.
Okay. And how has your recent health been? Do you have any fever, any other nausea, vomiting, diarrhea?
No, not really.
Okay. So it's just the belching and the chest pain, right?
Yes.
And the belching usually happens with the chest pain or?
Oh, yes. Shortly after.
Shortly after. Okay. And can you just tell me, do you have any other medical issues that I should be aware of?
I do have some high blood pressure.
Okay. And are you taking any medications for it?
I used to take medications, but I forgot the name.
Okay. So are you visiting your GP regularly?
On and off.
On and
Since
off.
I haven't really been to her office.
How long have you not been to her?
I would say roughly a little more than a year.
A year. And for the past 1 year, you're not also on your blood pressure medications?
On and off. I tend to just take it whenever I feel like.
And is there a reason for which you're not taking the medications?
I just don't believe in medications.
Okay. So can you tell me a bit, like, have you had a recent surgery or any surgery in the past?
No surgeries in the past.
Okay. And are you taking any other medications other than what you were supposed to be taking for the blood pressure? Anything other than that? Have you been taking any other drugs, over-the-counter medications, or any herbal supplements?
I was given a medication about 3 months ago from my last GP visit. It was for some tummy. It was to help with my tummy, help with it, but I stopped taking it because I don't believe in medications.
Okay. Again, you went to the GP, but you did not take your medications. So
I did.
What are you hoping for? Like, what kind of therapy are you more interested in?
Well, I just want to know like what is going on. I hope it's nothing too serious because I'm starting to pay particular attention to my health since the pandemic.
Okay. And have you had any recent investigations done? Because you went to the GP 3 months ago. So were there any investigations that he conducted for you?
She did tell me that I had to do some investigations, but I declined them.
You declined them. Okay.
Yes.
And would you be okay to go through some investigations if I prescribed any?
No.
You know, since you've been having this condition for the past month, how comfortable are you with your lifestyle, with having this burning pain and, you know, so wouldn't you feel better if you knew what it was with a few tests done? Maybe make your life a bit more easier?
One of the tests she described was pretty scary to me, so I just opted out.
May I know what test it was?
I can't remember, but she said something about passing a tube in my throat.
Okay. So that was probably one of the tests that the GP felt was necessary, and you are not comfortable with that at the moment.
No.
Okay. So if I tell you that with having a discussion with you and how I feel that you're uncomfortable with taking any medications or getting any investigations done, how about we do some lifestyle modifications? Would that be more suitable to you?
Oh yes, I will be very interested in that.
Okay. So before I get to that, can I ask a bit about your lifestyle?
So I eat particularly fried foods and a lot of spicy foods.
Okay.
Especially spicy chicken, spicy fish.
Okay. And how about any drinking?
Oh yeah, I drink a lot of sodas, a lot of pop, alcohol now and again.
Okay. So from what I can see that you're having some sort of a burning sensation in your chest, which is mostly related to your intake of spicy foods. So if we could lessen that, I think this would resolve your issue a lot. If you could reduce the seasoning, the spiciness in your food. I mean, I know it would be difficult for you considering that you find them more tastier as compared to other foods, but could we give that
so
a
what
try?
am I going to eat? What am I going to eat?
Could we try reducing them for like maybe a week and see how you are doing? And if you feel better, maybe this would be the reason for the epigastric burn at the moment?
We can do that. Is there particularly a dietitian that I can also talk to see like alternatives for me?
I would definitely refer to one, and I will book an appointment for you so that you can have a detailed discussion with what your choices of seasoning should be, so that we can lessen this without putting you on any pill or without doing anything. And maybe then you can check back with me after a week. How does that sound?
Oh, that sounds perfect.
Okay, kindly do see me after a week, and I've booked your appointment with a dietitian, and I will see you after a week. Have a good day.
Okay, thank you.
Bye-bye.
Bye.
All right. Dr. Hajra, you still have a minute.
I don't know what to do with that minute. I'm sorry. I mean, I was dragging it as much as I could. I don't know what I did. I mean, it ended up as a counseling session.
Yes, it was.
So you
I
wanted her
wanted
to
to-
counsel you, right?
I think I
It
was
was a
counseling.
yeah,
counseling.
I actually wanted to
Yeah.
take it to like a twist of things. Like, how about if I say no to like not taking medications and
It was
you know,
perfect, actually. That was
because
perfect.
like for me, like for my family, like they're so apprehensive on medication. So sometimes it's kind of like a counseling, and then it goes into like, okay, like a kind of management. So it's kind of like a mixture. But yeah, you did perfect. You actually aced it. You hit it out the park immediately.
Thank you.
So
You
well
did
done.
great, Dr. Hajra.
Thank you.
Yeah.
Thank you so much. Thank you for the
Managed your
confidence.
concern.
Yeah,
You
no, that was
reflected
perfect.
on it. You did all that was supposed to be done, and you were actively listening. You were
Yeah.
trying to scare the patient, but at the same time, you were very consoling, and you know, you were actually telling the patient what they wanted to hear, right? So
Yeah.
I guess that's the way about it.
Thank
Just at the end, you know, like just a little bit that you know, just at the end, just a little bit, if you could involve the patient a little more, just at the
Yeah,
end.
I mean,
Like,
I
like
should.
when they had
Yeah.
yeah, like when you were explaining to them about the counseling, you know, like that you're supposed to do this and this and this, just then, like you did come back to it, but just at the very point, like involving them, right? Like, because she had to jump in and say, you know, like, what would I eat?
Yeah.
So just at that point.
Yeah, I
Apart
just
from that was brilliant.
Yeah, I just felt a dietitian would do a better job than I would, because I don't know how to tell this
Definitely.
person not to have spicy.
No,
food.
you're perfect. You're actually really perfect. You're
We're gonna
perfect.
do
Yeah.
all of the counseling sessions, the counseling bits too. Right now, we're just doing the history bit.
Yeah, thank you
And
for
you
the
did
opportunity
awesome.
anyways. Thank you.
Yeah, you did awesome,
Yeah.
Dr. Hajra. Anybody else wants to be the doctor of practice or anything? Because if not, then I'd like to, you know, participate. Because it's been, I guess, 2 hours now.
Go ahead, be the doctor. I'll be your patient.
You want to be the patient. All right. Okay.
Yeah.
Just give me a bit and
Yeah.
then we can begin. Yeah.
Yes. I have to be a good patient.
All right, Dr. Hajra, if you're ready, we can begin.
Yes, sure. Let's begin. Muted.
All right. Let's begin. Good morning. This is Dr. Hafsa. I'm one of the junior doctors here. All right. Tell me, where are we? We don't even know that. I'm sorry.
Yeah, that's fine. I'm 67 years old. I'm called David, and I'm having chest pain, and I'm in the GP setting.
Okay, you are in the GP setting. Okay. All right. Okay. So let's begin. Good morning. This is Dr. Hafsa. I'm one of the junior doctors here in the GP clinic. Is this David?
Yes, doctor.
David, can you please confirm your date of birth for me?
Doctor, I don't remember my date of birth, but I'm 67 years old.
All right, David. So you're fine by me calling you David, right?
Yes, doctor, that's fine.
All right. So David, what brought you to the clinic today?
Doctor, I have this heaviness on my chest, and it's been going on for a very long time. I need some help with it.
All right. Can you tell me a little bit more about this heaviness, David?
Doctor, it's on my chest. It feels very heavy, and I can't breathe because of it. And it's been happening since the past few months, and it's just getting unbearable now.
All right. So it's been there for the past few months and it's getting unbearable. Can you describe this heaviness? Like, what do you mean by it? It being heavy? Is it kind of a pain, or is it just like something sitting on your chest? And you did say it was there for a month. So is that been continuous?
Yes, doctor, it has been continuous. Right now it's continuous. It wasn't continuous before, but since morning it has been continuous.
All right, it's been continuous. And are you having any pain at the moment anywhere in the body?
Yes, doctor, I'm still in pain. It hurts.
Where exactly would that be, David?
Right up on the upper chest, left side.
Left side, and it's been there since the morning now. And could you tell me, is that pain going anywhere else in the body apart from the upper part of the chest?
I think it's going to my arm as well as my neck and my head. Everything hurts on this side.
Okay, all right. I'm really sorry to hear that. It must be distressing. So I'm just gonna make it quick. Can you just uh, if, scale this pain for me, right? Like on a score of 1 to 10, 10 being the worst and 1 being the least, what would you say would be the severity of this heaviness and pain?
Doctor, I think right now it's at a 10.
It's a 10 out of 10. Oh, I'm really sorry. Are you comfortable enough to continue this conversation, David?
Doctor, I'm still in pain. What can you do
All right.
about it?
That's very right. So what we're going to do right now, David, is that I'm going to call an ambulance. And in the meanwhile, because it seems like an emergency, right? So in the meanwhile, I'll just be taking a quick, we're going to just have a quick chat to, like form diagnosis and manage you, and maybe would be sending you to the emergency. Would that be all right with you, David?
Yes, doctor, please help me.
Right. That is great. That is great, David. So, David, are you having anything else apart from this pain? Any sweating, any breathlessness?
Doctor, it is difficult to breathe and I am sweating a lot since morning.
I can see that. I can see that. I can see that, David. So, would you want a painkiller like right now?
Yes, doctor, if it's possible, please.
Okay, definitely. So I'd like to give you a painkiller and we'd move on with it. David, just a little bit more about it. Have you ever had this condition before in your life?
Yes, doctor, I did have it a few years back.
And do you remember what happened at that time?
There's just a chest pain, and my son, he took me to the ER and they put a stent somewhere in there. I had some investigations done. I don't remember, but I think they put like 1 stent inside.
Okay, all right. And were you prescribed with any medication at that time, David?
Yes, doctor, they gave me 3 pills to take every day.
Do you remember what those pills are, and have you been compliant with them?
No, not at the moment, doctor. I'm in so much pain, but yes, I do take the 3 pills every day.
As prescribed by the physician that time?
Yes, doctor.
All right, that is great. I must say you're doing awesome right now. So, David, do you smoke by any chance?
Yes, doctor.
Okay, all right, all right. So, David, I'm just gonna quickly, and apart from that, is anybody else in your family ever been diagnosed with this condition before?
My dad, he died of a heart attack.
Oh, I'm sorry to hear that. And how old was he?
He was 67, just like me.
All right, all right. Okay. And David, are you allergic to any medication at all?
No, doctor, no allergies.
All right. Okay, so David, any other medication that you're taking apart from the medications for this particular condition that you had?
Just a multivitamin that I take.
Okay, all right, David. So would that be all right with you if I do your examination? I'm gonna go check in your vitals, check your chest. Would that be okay with you?
Yes, doctor, that's fine.
So I'm going to take your vitals, including your pulse, your blood pressure, and your temperature. Apart from that, I'd also be doing your chest examination, which would include the inspection, auscultation, a percussion. So anything there?
No.
Okay. So
did you say blood reports?
Yeah, no, I did not.
Blood reports?
I'm going to go forward with it. All right. So along with that, and meanwhile, since the ambulance is on its way, I'm going to also go for some cardiac markers. Would that be okay with you, David?
Yes, doctor.
And an ECG.
Yes.
Anything there?
Yeah, ECG just shows an MI. He's having a heart attack.
All right, he's having a heart attack. All right, I'm sorry. All right. Okay. All right, David. So based on what you told me and that you were in a distressful situation, you had a pain which was on a scale of 1 to 10 being 10, and I see you were in obvious distress. So I think that what you might be having at the moment is another MI, right? And I'm really sorry to tell you this. I hope that you're following me, David.
Yes,
Are you
doctor.
understanding? Right? So what we're going to do right now is that we're going to start you on the basic management for this, which would be, like giving you a painkiller, putting you on oxygen, and then giving you some aspirin. Would that be okay with you?
Yes, doctor.
Anything else that you want to ask or if you're concerned about?
So right now the ambulance will take me to the ER, and what will they do for me?
Well, they're going to repeat the blood markers. They'll do some further tests. And after that, they'd be referring you to a heart specialist, depending on what comes in the tests later on, right? Are you following me, David? Everything clear?
So how will the pain go away?
Well, they would be starting you on the painkillers, right? Like I'm going to give you the morphine at the moment in the IV form. That would definitely help with the pain. And if it keeps on going on, then, they might send you for what is called a PCI, right? They might go for, the stenting that you had earlier. They discuss it.
Move on to the next station.
I'm so happy to send it because I didn't know what to do.
Well, that's not the thing that you're supposed to be saying. You're supposed to know how to explain PCI.
Okay, yeah, you're very right. You're very right. I knew I would try that. So how did I
Yeah.
do? Was I the worst?
No, it was actually fine. In blood test, I would have told you that the patient also had a high cholesterol. So you would have understood why he's having the second MI because he didn't take care of his diet. And
But the GP clinic, we don't have those kind of blood results like immediately.
yeah. We don't. That's true.
What I was worried about. Yeah.
That's true. So now overall it was fine. It was fine with me. I don't know if anybody has anything else to add to this. Overall, yes, we are still lacking on getting to the management part till the head, but you were fine with that this time around. I think we got to the thing on time and you went with the
So
ambulance.
happy about it, I'm
And
so
with-
happy that I got there.
Yeah,
I was
it was
like, go get into your ambulance, have fun in the ER.
it was because you organized yourself really well this time in the beginning, especially. It was very organized. Your data gathering is really organized this time around. Even when you got to the past medical history and you asked all the relevant questions, you asked about the family history, you asked about the previous episode, everything was very spot on. Like, what's your medical history? What's your surgical history? Everything was really great. And personal history, yes, you did only ask, I think, about smoking, but that's fine because that is the main important thing that you're supposed to ask for. In this
I
case,
think I didn't ask about the alcohol, right?
it wasn't relevant. It wasn't relevant. So that was fine. Even if you skipped it, that was fine. Because in this case, it's smoking, it's the poor diet. You could have asked about the diet, yes, that you missed on. You could have asked about the physical activity and the stress. But overall, because the patient is having a heart attack, so it was very smart of you to keep it limited. The patient was already distressed.
The patient would annoy. He would be so annoyed. No,
I was getting annoyed. I mean, I could feel the old guy getting annoyed at you. I was literally projecting
I
that.
asked him, what do you eat? What do you eat in a day? And he goes on like, I don't want to eat anything. I just want to get rid of the pain. No.
Yeah. But the thing that when you said, like, can I give you painkiller? I did play along, but I think you're not supposed to give them painkillers like that.
Right.
Yeah.
So how would you say that, Dr. Hajra? Like, because I did ask the persons that I'm in contact with, the people that I'm in contact with, and they said that, you should offer them. I'm not very sure on that part because the GMC, we are very big on the GMC errors, not to do and not to repeat. I'm just following that all the time. And they specifically have said that do not make belief on if you do not know if you're going to get the painkillers to give it to them. Right. So what do you think we're going to do?
Yeah, exactly. So what we have understood with the online session that I've had is that because it's just like a 8-minute history that you're taking and you have 4 minutes just to gather the information. So in your head, you should be focused that, okay, I need to understand what the diagnosis is. I need to remove the differential diagnosis because there could be certain underlying contraindications to giving this guy simply a painkiller because you wouldn't know what to give right now. You need to know that they're not on some blood thinners. You need to know all that. So you need to get to the whole, data gathering part. You need to get till the end of management. And then towards the end, when you're fine with your diagnosis in your head and you have the full picture, then you can say, because, at the end, you were supposed to give them the morphine, the oxygen, the nitroglyceride, and the aspirin. So you were giving them at the end. So that was fine. So you wouldn't have needed to say that in the middle. But I played along, but there was no need for it. All you could have said, I know, and I can see that you're in discomfort, but I need to understand your situation better so I can give you the appropriate painkiller for your situation. So that would be the best way to put it. Like if the patient,
the thing is that, like a lot of us, and even like in the practice with different kind of teachers that they do, the mock sessions, etc., they start off by, like, the patient comes in with pain, they're saying that, is it all right, are you comfortable enough to talk, or should I give you a painkiller? Like, how would you begin? If you were there, how would you begin? How would you begin? If the patient came in with the pain, right, and they said that it was like really, really severe, like you had, then how would you play along? Like, you just say that, all right, I can understand, but is it all right if we have a chat? Are you going to do that?
Yeah, I would say that. I would say that, yes, hello, good to see you. And I can see that you're in a lot of pain. And right now, I'm going to do the best that I can. And if you're are you comfortable? And if they say, no, I'm not comfortable, I'm still in pain. So I would like, yes, I can see that you're not very comfortable, but I would like to ask you a few questions so I can understand your situation better, so I can give you the most appropriate medication for your situation. Because that would make sense to the patient. You don't want to just give them anything left, right? You want to give them the specific drug. So even the patients, they would understand that, because whenever a doctor is going to tell you, like, I need to give you the specific thing to your situation, you will, say, okay, I can do this. I can get through the history, and you can keep on saying that, I know it's, whatever, you're not comfortable still.
Like, just drag him, because it's only 8 minutes. He's been in pain for since morning.
Exactly.
So he can be in pain for 8 minutes more. You're very right. It makes sense.
Exactly. You're just going to say, I can still see that you're not comfortable, and I know this is difficult for you, but let's just push on a bit, and get to the end, and we'll get you all of the medication that is appropriate for you.
Sense. I mean, if he's having pain for like such a long time, like if he just marni jayega, if he can hold on
exactly
for like 8
and and it's the same in the ER. You have to remove the DDs. What if he's on a blood thinner and you just give him some medication and make him worse? So just play that in your head. Just like say, okay, I don't know the DDs right now, so don't give them a painkiller just because that's an IPS thing that we've been taught. Okay, hand him the Panadol. No, what if it's the wrong thing to do, and you later on find out, okay, he was on a blood thinner, then you just kill your patient. So then you've failed.
That's true.
So that's
then
not,
it's on you. The blood is on your hands, right?
Yeah, exactly. So overall, it was fine. It was really
You're a
good.
good sport.
Thank you.
The fine works for me all the time. I've been told it was fine, and it works for me. Thank you so much, Dr. Adra.
Perfect.
All right. Anybody else wants to do it? Because if not, then maybe we can simulate one more.
Can I do the doctor? Can I do the doctor for the next one?
Yeah. You can definitely be the doctor, and maybe I'll be the patient. Would that be okay with you?
Yeah, sure, of course.
Your name's Dr. Revan Atta, right?
Yeah.
Okay. All right, Dr. Atta, whenever you're ready, we can do this. All right. Let me just tell you that the person is 67. Their name is, let's say Alex, and they are in the GP clinic. Okay.
67, Alex in the GP clinic, presenting with chest pain, right?
Chest pain? No, he's not just having the chest pain. He's having chest pain and shortness of breath. Okay, chest pain and shortness of breath. Okay, Dr. Atta, is that all right?
Yes.
Okay, all right. So whenever you're ready, we can start.
Okay, you just give me like 1 minute.
Yeah, definitely. Dr. Atta, should we start?
Yes, doctor. Yes, let's start.
Okay. All right. Just give me a minute. I'm going to just set the timer, then we can begin.
Okay.
All right, Dr. Nichols. All right, Dr. Atta, whenever you're ready, we can start. Okay?
Okay, yes, I'm ready now.
Okay.
Hello,
Speaking.
I'm Dr. Nata, one of the doctors here in the GP. May I confirm your name and date of birth, please?
Yes, doctor. My name is Alex, and I was born in 1994, 27th of May.
Okay, so what brings you to the hospital today, Alex?
Well, doctor, you know, it's been really hard for me to breathe, and I'm trying to catch my breath, but it's very difficult. I cannot just breathe.
Okay, I can see, I can imagine this could be very stressing for you. Could you just give me more information about that in order to be able to understand your condition in a better way?
Well, doctor, it started when I was doing exercise, and it's just been getting worse. But you know, I've had this since like a month now, but now it's just today it got really worse, and I thought that I should, you know, like come to the doctor, and this is why I fixed an appointment with you.
Okay, so you're telling me that it's been there for a month and it usually happens with exercise.
Yeah.
Right? Yeah. So anything else that makes the shortness of breath worse apart from the exercise?
Yeah, you know, like anytime I do exercise, I am also diagnosed with asthma. So it just leads on to that. And when I am lying down, it makes it worse as well.
Okay, all right. So you said that you're diagnosed with asthma or eczema?
Yeah, eczema, eczema.
Eczema? Okay. When was that?
Well, when I, you know, like a year ago, and I've been using steroids for that.
Okay, and are you compliant with your medications?
Yes, doctor.
Okay, all right. So anything that makes this shortness of breath better?
Yeah, when you know, when I rest, when I sit up, that's when it gets better.
Okay, so it's also worse on lying down, right?
Yes, doctor. Yes, doctor.
Okay, okay. Anything else that's bothering you apart from this shortness of breath?
Well, doctor, nothing else. I do have a little bit of chest pain, but it's not that much. But the shortness of breath, that just makes me feel really bad. You know, like it's the worst. It's getting really bad. I can't even walk anymore, and you know.
Okay, yeah, I can see that you're that's really that it's really affecting your life. We'll be definitely helping you with this, okay? Okay, so tell me about the chest pain more, please.
Well, doctor, it was just there in the morning, but now it's gone. At the moment, I'm more concerned about the, you know, my breathing. You know, it's very difficult.
Okay, so yes, okay. So do you have anything else apart from the chest pain and the shortness of breath?
No, doctor, nothing else.
Any cough?
Yeah, I'm coughing a little, but you know, that was because of the flu that was because of the flu that I had, and it turned into cough. But right now, it's not there.
Okay, so you had the flu. When was that, please?
It was like a month ago.
Okay, and were you managed for it?
Yes, I was. I mean, it went away on its own, but right now I don't have the cough.
Okay, so do you think what you're having now, do you have an idea what could be going on with you?
I don't know, doctor. I mean, I had an MI. I mean, I had a heart attack earlier. I don't know if it's the same thing. because it's very bothersome. But this has not happened before.
Okay, so you had a heart attack when exactly?
It was like 7 years ago, doctor.
Okay, okay. And okay, have you been diagnosed with any other medical conditions?
No, doctor.
No hypertension, no diabetes.
Yeah, I do have high blood pressure.
You taking any medications for it?
No, I'm not taking any medications at the moment because, uh, I've stopped taking those medication. I was taking, this blood pressure medication, but I'm not taking that one either anymore.
Is there any specific reason why you're not taking them?
Well, doctor, there's no one around to give me those medication, and I forget them at times.
So you are living alone at home, and no one is there to help you with the medications. That's what you're saying, right?
Yes, doctor.
Would you like us to offer you any help regarding this matter?
Yeah, but at the moment, I'm very concerned about this shortness of breath.
Okay, all right. If you need any help about that, you can contact me, so we can book another appointment and discuss this together. Okay. Okay. So coming back to your shortness of breath, are you? Yeah, you're welcome. Are you diagnosed? Okay. Are you on any medications?
Well, yes, doctor. Nothing apart from the ones that I told you.
Okay. Okay. All right. Okay. So thank you for answering my questions, Mr. Alex. I would like to examine you now. Okay. I will do a general physical. I will start by checking your observations. I'll do general physical examination and examine your chest closely. Okay. I'll also be sending, I'll have a chaperone with me to maintain your privacy. I'll also be sending some initial investigations like blood and chest x-ray. Okay.
Well, the X-ray shows that there is some increased vascularity there.
Okay. And is there any opacity or something?
Sorry?
Any
No
opacity?
opacity. No opacity, no opacity. Just increased vascularization there, like the curly bee lines thingy.
Okay. Okay. So from the
did you examine the chest?
Yeah, exactly. Yes, I did.
Right. So there are crepitations in the chest, and that's it. That's it. I don't think you ordered any ECG, etc. at the moment.
No, I did not. Okay. So from for having listened to you, Mr. Alex, and examined you, I'm suspecting that you seem to have a chest infection.
Chest infection, doctor?
Yes.
All right, doctor. But like, how is it going to go away? Like, I have lots of shortness of breath. What are we going to do right now?
Well, I will give my senior management plan.
All right.
I don't think I was able to diagnose it, actually.
I was the worst kind of patient. You did good. I was the worst kind of patient. I did it on purpose.
Oh,
Yeah. Like I was telling you so many things, and I said that I'm on low mood and I don't have anyone around me. I don't take my medication. I was having lots of things, right? Like we're gonna have such patients too. But there was one thing that I was consistent on, saying that I have shortness of breath. If you are saying that the patient has a chest infection, did you ask if I have fever?
I think, to be honest, I wasn't sure about the diagnosis. It could be heart failure, or is it heart failure?
Yeah, it is heart failure. It's heart failure. So, like in the history taking, do not forget to ask about psychosocial and red flags, right? Red flags in the chest could be, like heart failure, like you should ask about the fever, right? Some, like if it's chest pain or shortness of breath, you can also ask about the things related to cancer, maybe TB, etc. So flaws, right? Like fever, lethargy, appetite loss, any weight loss, any swelling, right? So, and when I said
Yes.
curly B, I was just giving it away that it's heart failure. However, you did good. I didn't tell you that I have swelling in my legs. I forgot to. And if I don't, then, if you do a general physical examination, the doctor, the person's supposed to tell you. So it could be on the chest x-ray. If you were to order, it could be a pulmonary edema, but because this is a GP setting, I don't think that we should be ordering, right?
Which one? What should we be ordering?
The chest x-ray, the ECG, the cardiac enzymes. I don't think we're going to get those in the GP clinic, no?
Okay. Yeah. So what investigations was I supposed to order?
You could just, because it's going to take time for them. They're going to go somewhere else. They're going to get the radiology done, and then they're going to come back. So you could just have said that, this is what I think, and I'll be sending you off with an ambulance to the emergency department, and then they'll take care of it. But it seems like that you might be suffering, or you might, instead of saying suffering, it seems like that it's a condition where the heart becomes very weak, and they cannot the heart cannot pump blood out of it, and the fluids accumulate, and there could be swelling. That's why you're having the shortness of breath, and this thing is called as heart failure. This is why I'd be sending you as soon as I can with the arrangement of an ambulance to the emergency department.
Yes. So this is yes. So yeah, should be sent to the emergency. It's heart failure.
But it's not your fault. I was a bad patient.
Actually, no, it's okay. Actually, yes, thought of heart failure because he said that the shortness of breath was worse on lying down. So this is like a prominent sign of pulmonary edema or heart failure, right side of heart failure.
You're very right.
So I did yes, I did think about it, but I was kind of confused.
No worries. No need to be confused, right? Like, see, the main thing about this exam, I guess, are three things that's what I've got to know till now. Number one, IPS, interpersonal skills. Number two, being confident. Number three, being honest, right? But not being honest in a way that, I guess, Dr. Nichols was that she said, unfortunately, sort of, and then that like where she did not even give the differentials. So we have to be honest that, if we don't know, then we could just give them DDs that we're not sure what is happening, but being natural and all. So I guess you did good, Dr. Atta. Have you been practicing before?
Yes, my exam is in March, April, sorry.
In April. All right. Mine is at the end of the April too. Don't worry, we're gonna get there. Are you taking some course in academy? Just asking if it's all right for you to answer. That's okay.
Yeah. I took with the Mo Sobhi's online course, only the silver package. But I don't know if I would be any other academy as well again, because they all try to learn from different academies.
Yeah, that's true. Well, I'm also doing that, and I've not even started, to be honest, right? I'm gonna just do it, inshallah. So, Dr. Atta, do you have any questions? Want to say something? Anybody else who wants to give a review? Because we've been here for like 2.5 hours now.
Yeah. Thank you, Doctor. So, Doctor, when do you usually give this session so that I can join?
We're gonna do inshallah like every day. Inshallah every day. I don't think that you are on the group, are you?
No, I'm not on the group because the admin, there's something, he's not available at the moment, so he's he's not approving my request to join the group because he's not there. You mean the group of Dr. Baha and Dr. May and Dr. Anusha, that group, right?
I have no idea which one you were saying, but you could take my
so
number. You could text me on WhatsApp.
Yes, that would be great. Yes.
Yeah, you could write it down right now if you want, because I don't know if after this would be getting in touch on any way, because if it's gone then the link, I don't know if you'd be able to text me, right? So you might want to write it down. It's +92.
Wait, +92.
336 2864.
Again, please. Sorry.
Yeah. +92.
Yeah. Okay.
336. 2864.
2864.
151.
151. Okay.
Yeah, this is going in the recording, right? So that's no good.
Okay.